Okay, a lot better.
Oh,
We're good. Doctor to the rescue over here.
Oh my God.
Okay, my heart dropped
you.
and my soul is gone right now. Okay.
Sorry about that, guys.
All right, okay, much better. Okay.
Awesome. Okay.
We did have a question up here. I want to make sure we get the questions amongst the you have an echo, Doc. Okay. Brian Green asks, all right, Nexus letter question out the gate. Brian Green asks, what does a good Nexus letter look like for sleep apnea, secondary to PTSD, medication, and hypertension?
Ooh,
Go ahead and take that one, because there's 3 different connections here. Is 3 good? Is 1 good? What's your opinion on that?
Yeah, that's a really good question. So sleep apnea is one of the toughest ones, right? To get connected, it gets a lot of pushback, and the thing about it is that there are a lot of people who advertise that they'll connect sleep apnea secondary to PTSD alone. But that's not a good way of doing it. The reason why is the VA pushes back on that, and they say that there is no mechanism at which PTSD will cause an obstruction in the airway and cause sleep apnea. So they don't abide by that, right? Now, there is an association between veterans coming back from Iraq, Afghanistan, with PTSD who are at an increased risk of sleep apnea. But it's an association, it's not a causation. So what you have to do is relate it to multiple things. So it's a constellation of factors, right? So in that case, what I do is I'll keep the PTSD in my back pocket, and then I'll incorporate other things. All right, so were you deployed to Kuwait, Iraq, Afghanistan, any of those places? Okay. So that means you were exposed to heavy particulate inhalation, right? And there's studies on heavy particulate inhalation, how it increases airway resistance, and so you can say secondary to that, and you bring in those articles, okay, that confirm that that's the case. It helps if you have maybe like a presumptive condition from being in one of those places, like maybe sinusitis or allergic rhinitis or something like that, because those conditions also increase airway resistance, and they clog up your nose and they promote mouth breathing, which causes more sleep apnea. Okay, so those are some of the things. So I try to connect multiple things, and then medication comes in, which is like certain muscle relaxants, gabapentin, certain pain medications, benzos for anxiety. Those too can cause sleep apnea or worsen it. So bringing that in too, pretty much. Sorry, I rambled there, but hopefully that answers the question.
You are, we got a doctor on the stream. We want to hear a doctor's answers. Let me dumb it down. I'll dumb down the stuff. You do your thing. All right, we have another question. Filed PTSD for sexual trauma that happened over 30 years ago. Okay, so now there's a time frame gap there. I was very elaborate on how it affected my life. What are the chances of it being approved? Before you go on this, doctor, there's 2 things I want to point out. One, there's a huge time gap there. Okay, the longer you go, the harder it is. It's not impossible. Nothing's ever impossible with the VA. But what it really comes down to is your medical evidence. Did you report it while you were in service? Which 30 years ago, I mean, even today it's frowned upon, and I'm willing to bet 30 years ago it was extremely frowned upon. But those are the 2 things I see just from that question. So I really want to know if it was reported, to even give solid advice on that question. Do you have anything to add?
No, I agree. Yeah, it is a big time gap, and without something to help substantiate, I think it can be difficult because, maybe you had talked about the trauma with somebody else. I know that. Yeah. I know buddy statements sometimes are hit or miss, but that would help. If there was a buddy statement, maybe you talked about it with somebody, confided in somebody, and they knew about it.
Yeah, exactly. One thing on lay statements too, I have to scroll down and find another question. All I see is still an echo, still an echo, still an echo. That was
Oh,
before. We're good now. We're good now.
okay,
That was
good,
before.
good.
On lay statements, if there was like a ranking system of what the VA considers proof, lay statements and like personal, a self-report would be like at the very bottom, right? And so if you self-report and write a buddy letter, or you have your spouse write a letter, or your friend write a letter, or you write a lay statement, it's still the VA rater is going to take that into consideration. Don't get me wrong; it's not going to be brushed off to the side. But if there's any evidence that contradicts that lay statement, I mean, it's not proof, right? It's actually the opposite. If lay statements support the medical evidence, that's when it's like, okay, here's how this medical evidence affects this veteran's life. That's really where you see lay statements shine, versus the opposite, which is like, hey, I don't have evidence, let me write a lay statement. It's just not going to work. All right, Randy Marsh from South Park. He has a profile picture of Randy from South Park. Okay, if I used up my GI Bill and I re-enlist, will I get another set of GI Bill after second enlistment? No, you will not. The GI Bill it's not a one-time use, but you have 36 months. There are circumstances where if you use your GI Bill, you can request more to finish a certain program. And if you have $1 left on your GI Bill, you can always go the VRE route, which is vocational rehab and employment. But keep in mind, VRE isn't really an education program, it's an employment program. You would have to argue your disabilities are keeping you from employment, and therefore you need additional training, and that's how you can kind of snake that into getting maybe a grad degree or becoming a psychiatrist like Dr. Sharma here, right? Did you use any GI Bill or anything like that?
Yeah, it's interesting. So yeah, so I did the the Air Force program for medical school. So they paid medical school, which was amazing. And then after I got out, after I finished being a flight doc, I didn't know, and one of my friends told me that I could use the GI Bill when I was in residency
Mm.
studying psychiatry over here in Baltimore. So I used it for living expenses, and they gave me living expenses in
Oh yeah.
Baltimore. Yeah,
Oh yeah. Awesome.
yeah,
All right,
that's
John
awesome.
Johnson. I'm trying to catch down to the bottom. We got lots of questions,
Yeah,
guys. Thank you for the questions. Keep them coming. Without questions, there is no live, right? So John Johnson, straight. I'm gonna pawn this one to you, doctor.
yep.
Can you write a Nexus letter for TDIU for PTSD?
Oh, yes. So that involves doing a Nexus letter and a DBQ, Disability Benefits Questionnaire, and we would have to prove a few different things on it. So like total social and occupational impairment, and then we would go through. There's sort of a range of questions that I would take you through, and we would go through all that. Obviously, I would review past records and things like that. But yeah, I can definitely do that. Hmm.
Yeah. One thing I want to add to that too
Hmm.
is if your PTSD is causing you to not be able to work, right, which is TDIU, you can't work, so they're going to give you a 100% rating for extra money, right, so you can survive. Keep in mind that one of the main symptoms of mental health conditions, disabilities, is not being able to hold gainful employment. So that Nexus for TDIU just actually might bump you up to 100% on P&T. Even if it's not initially, right? You get that TDIU Nexus, you get it approved. So now you're 100% TDIU. A year, 2 years, 3 years can go by. The VA is going to review that. And depending on your symptoms, it's I'm not going to say it's common, but it's not out of the ordinary to be awarded P&T off of TDIU, and then you can work, right? But obviously, if you're TDIU for PTSD, you probably can't work, but you have the option. At least you can make more than like 13 and a half grand a year, whatever the statute for TDIU is, right? All right, Tony P.
Nice.
And sleep apnea secondary to chronic sinusitis. What you got for that?
Oh yeah. So yeah, you can do that. The chronic sinusitis is a good one. So that's one of the factors that can worsen sleep apnea. again, when I go for sleep apnea, I always try to look for multiple factors because the VA fights so hard on it. So there's sinusitis. I'm going to go into the records and look for anything else. Okay. I'm going to look for medications. I'm going to look for where you were deployed. I'm going to look for, any other conditions that are out there. Is there any asthma, rhinitis, anything? But yeah, you can do it. Mm-hmm.
All right. Doc, not you, someone else named Doc. Can you file Meniere's disease secondary to tinnitus, right? Which is what's that? That's like dizziness. Is that what that is? Am I right? I'm not a doctor, right?
Yeah, it's part. Yeah, dizziness, vertigo is a part of it.
Okay.
For that, you would have to have documentation of the Meniere's and a diagnosis. You can also get I actually know of one, a forensic audiologist who can make the diagnosis and write a letter for it as well.
All right.
Yeah.
I got two things for that. One, let me know who that person is. What are you doing keeping this information from me? No. Two, he has a follow-on question. Is that a stretch? Like, how much of a battle is that going to be? Which I guess to answer that, I have some other questions for you, Doc. Doc in the chat, not Dr. Sharma. I want to know, what are your migraines like? I want to know, do you have dizziness? Do you take vertigo medicine like metclazine? I believe is commonly, given out to veterans by the VA. So that's definitely something that would come into play. And again, just as Doc said, you need a diagnosis, service connection, and a current diagnosis, a service connection, and an in-service event. But all right,
good point. Yeah.
So Brian Green, he had the sleep apnea question that we first answered, if you can remember that. He's added that he's a Vietnam veteran with PTSD and hypertension service connected. And does that change? Does that change your opinion on the sleep apnea? Would you be able to better write that nexus with sleep apnea if someone was service connected with PTSD and hypertension? What does that look like?
Got it. So the question is, if we only have PTSD and hypertension, right, as the factors, I would not be able to write a good letter for that, and I wouldn't, I would right up front say, I don't want to have you waste any money on a letter, so I wouldn't do it. The reason why is many scientific articles show that sleep apnea causes hypertension. And that's how it's commonly understood, like the pathophysiology of it. So that's why it gets hairy there, So I would still look for other things. So I would still look at the records and try to find something else.
Yeah, you bring up a great point. I want to let everyone in the chat know, because you said you wouldn't write that letter if this veteran came to you. And one thing that draws me to Dr. Sharma is you actually review the case before you say, hey, here's my fee, pay me first, right? You actually review the files, which I think is huge. It really takes away from the for-profit version of Nexus letter companies, right? One, thank you for that. I appreciate it. I'm sure everyone here appreciates it, but yeah.
You're welcome. And thanks for saying that. And it's like... And the reason why is like I feel like I have a reputation to uphold. Like I want my letters to be successful. I don't want it's one of those things where I want the letters to be successful. I want the veterans to get that compensation they deserve from that condition, and I want them to trust me. Yeah.
Absolutely. Yeah. Mm-hmm. Long-time supporters in the chat. Thanks, Next Level Cash, Mario, Lee Garrell, USMC. Hey, thanks guys, appreciate it. B-Buck, thanks for coming back. All right, next question. All right, I'm definitely not going to say this right. Themistocles. My question is, since sleep apnea is a medical condition, shouldn't a medical doctor write the Nexus letter? And that opens up lots of questions for me, and I think you're going to answer all of them.
Yeah. So excellent question, Themistocles. Sorry to butcher the name.
This thems.
Thems, yeah, thems. Okay. So yes, that brings me to one thing about you got to have the person with the right credentials and background and education, right, to do it. So it has to be a medical doctor. So when I say that, it has to be a physician, right,
Yeah.
and somebody who went to medical school, right? So, like one quick thing is psychiatrist. So I'm a psychiatrist, and there are psychologists, right? Psychiatrist, somebody who went to medical school and specialized in psychiatry. A psychologist is somebody who did a PhD in psychology, right? So it's very different. And so, yeah, you should have a medical doctor write it. Sleep apnea is one of those where it's actually pulmonology and psychiatry. So pulmonologists diagnose and treat it. And it's also in the DSM-5, and psychiatrists can diagnose and treat it as well.
All right. That is, I would never have answered that like you just did ever in my life. I do want to point out something. You mentioned it, but you kind of did this horizontal thing to let everyone know, like, if I was to get a Nexus letter for a mental health condition, I would go to a psychiatrist. Okay. Can you get a Nexus letter from a psychologist? Yes, you can, right? You can pay for it. It'll be a lot of money probably. And you can submit that with the VA. And could it get approved? It could. Absolutely. That's not too far from the truth. But I will say this. The VA is going to have a CMP exam probably, and you're going to go see a psychiatrist. And then any opinion that psychiatrist disagrees with, because they're higher on this ranking system, so to speak, the VA is going to lean towards the psychiatrist's opinion versus the psychologist's opinion. So if you're going to get a Nexus letter, just go to the top. There's no reason, why not catch the big fish? All right. That's my when I say I'm going to dumb it down, that's what I mean, right? Keep it Barney. I'm a Marine at heart, so I got to keep it Barney style. Okay. Nice. Donald Hudeck, he has a 2-part question. Lots of information here. All right. I currently have the following VA disabilities: 10% for angina. I don't even know what that is. And 40% for prostate cancer. Okay. I have been VA diagnosed by 3 doctors for peripheral nephropathy, all concurring with each other. All right. The problem is which category my neuropathy level would fall under, as no one seems to know, and I'm afraid to submit a form if I could lose all my existing disability levels. Do you have anything on this? That's a lot. I definitely have something on this last part here. You say I could lose all of my existing disability. So one, this is something I see super common in the veteran community. They're always like, hey, if you claim more disabilities, you have a chance. It opens up your entire file, and you have a chance for your disability to be lowered, which is true. All of that is 100% true. There's nothing wrong with that at all. But that brings me to the backside on why it would be lowered is because your medical evidence suggests you don't have that rating anymore. So it comes in 2 parts. One, what does your medical evidence look like for what you're already service-connected? Have you been continually seeing your doctor, maybe once a year, once a quarter, half a year, whatever that looks like? What's your treatment? Have you told your doctors you've improved? And if you're seeking care and you haven't improved, the VA is not going to lower your rating. Okay, it's the cases where, hey, I got rated 20. I got rated 5 years ago for my knee. I've never been to any appointment for my knee. I've never complained about my knee. In fact, the doctor asked me how my knee was, and I said it's fine, right? Now, all of a sudden, the VA looks at your medical records. They're like, oh, his knee's fine. Now that 10% rating goes to 0. So those are 2 different cases on where medical evidence is king. So as long as you keep going to healthcare, there should be no anxiety there about losing your disability. Okay, Doc, you got anything on that?
Oh yeah, that you covered it. The peripheral neuropathy question. So I'm not a cardiologist. I know the angina is chest pain, and then you have the prostate cancer. The peripheral neuropathy, should fall under neurology.
Mm-hmm.
So getting sort of the neurology forms, and I got to look and see which forms neuropathy is under exactly, but I can look into that also.
Oh yeah,
Yeah.
and also I'm glad you brought that up because I totally forgot that. Anytime, like how I said, I don't know what angina is. Um, I'm not a doctor, right? I'm just some dude that understands the VA. What you want to do is go to Google, type in your disability, and type in 38 CFR. So I didn't know what angina was. I could use my phone. I could type in angina 38 CFR, and I would know exactly the symptoms and how the VA rates that. And that's kind of how I would go about saying, okay, well, the VA rates these symptoms. What are your symptoms, right? That's pretty much what VSOs do. They don't know every disability. They just understand the 38 CFR, and they understand how the VA works. So, all right,
Nice.
great on that. All right, USMC
Oh,
Big B, go ahead.
we might have missed Michael McQuinn, just above Vietnam.
Yes, I'm glad. Yes, we did. Okay, PTSD and IBS and GERD. All right, that's all you.
Great question. Yes is the answer, but basically, we can definitely connect irritable bowel syndrome to PTSD, GERD to PTSD. There's a lot of studies showing that PTSD and anxiety and depression can cause those things. It's related to anxiety, which is a big part of PTSD.
Absolutely.
Yeah, and so we can definitely do that. It helps, of course, like Clayton, you were saying before, if you've got records, you're being seen by doctors,
Oh yeah.
whether, yeah, it helps to have that documentation, but we could definitely connect it. Yeah.
All right, awesome. John Sullivan, we're nearing the bottom here. We're almost caught up. All right. Can you file aggravated mental disorder for toxic exposure from an in-service exposure with anxiety, depression, and sleep disturbances after the VA diagnosed me with BPD after my discharge?
Got it. Okay. So you
That's a lot.
can,
That's a lot.
yeah, you can file that. I guess I would want to know more, like I mean, without revealing, what you don't want to reveal, but like what the exposure was, and like how traumatic it was, I guess, and then going off that, it sounds like BPD, a borderline personality disorder or bipolar disorder. I know usually it refers to borderline, so maybe they diagnosed that. So I'd probably need more information.
Yeah, on that note, so BPD, that's bipolar personality disorder, right?
Uh,
Um, right? Is that
borderline person.
okay?
Yeah.
Sorry, yeah. Sorry.
Yeah, no worries.
So, which is completely different, but regardless, both of them are under the same umbrella of mental health, right?
Yes.
And so, you have a diagnosis of a mental health disorder. Okay, that's great. Your question is, can you file aggravated mental disorder from an in-service exposure with anxiety, depression, sleep disturbances? So anxiety, depression is just going to be tacked under that BPD. The only reason I think a veteran should file, let's say you file for PTSD, anxiety, depression, BPD, whatever other mental health disorder you've been diagnosed with, the only reason you would file for more is if your symptoms would push you up at a higher rating, right? So let's say you had anxiety rated at 30%. A few years go by, right? Your back pain causes you to miss out on life events. You get depressed, and now your depression symptoms would have you rate at 50% or 70%. That's an example of saying, okay, I already have a mental health condition, but I'm going to claim depression because now those symptoms will bump me up in that mental health rating and 38 CFR. So, all right.
Awesome. Agreed.
LG, longtime supporter, what's up? Thanks for coming back. He said, what's up, guys? Been looking forward to this. Is sinusitis and rhinitis rated the same or separately?
Oh yeah, that is separate.
Yes, they are.
Right?
Yep,
Yeah. So it's presumptive from the PACT Act as well, and they're separate.
absolutely. I'm glad you brought the PACT Act up. Those are definitely presumptive. But again, when it comes to PACT Act, because a lot of people, I think, are confused by the PACT Act or they make it overcomplicated, it's really not. They have a list of conditions. You either have them or you don't. If you do, then that's step one. Do I have these conditions? Step two is, okay, was I in country during these time frames? And if those two match up, that's it. That's all you need. No reason to overcomplicate it. If you believe you have a condition but don't have the diagnosis, then your next step would be to get the diagnosis, right? And then you can just file a claim under PACT Act and then wait, 8 months and it'll be approved. All right. I'm just going to call this person V because that name, I'm sorry, dude. I don't get. Oh, Valhalla BJJ. That makes sense. I had to separate it there, right? Okay. How much medical proof is there that PTSD may cause / aggravate GERD, and is there a connection that can be made?
Yes, great question. Yeah, there is decent proof on that. What we have to do is take it from the anxiety route. So PTSD comes with a lot of anxiety, and anxiety can worsen GERD. There's decent medical proof on that. There's always a kind of hierarchy of different medical proofs, right? So PTSD causing IBS technically is a lot stronger than causing GERD, but it's still there, and we can do it. And and then also I'd probably look at the records to make sure the evidence is there too.
Oh yeah. Also, I think I'll say this a few times tonight, guys. With all these mental health questions, if you want Dr. Sharma to review your records and you want his services, send him his website is on this side over here, Concise Psych. Usually I'm in the whole screen, so I can't use my arms. It's above Dr. Sharma, ConcisePsych.com. All of his contact information will be there.
Thank you.
All right, so next question, John Johnson. Can a peacetime veteran in 1987 recently diagnosed with COPD had been exposed to jet fuel? Would I need a Nexus letter? Thanks. Okay, so the PACT Act definitely does not apply there, right? That's a good example of having a diagnosis, but you don't meet the criteria of being in country during X time, okay? But that does not mean that you can't get it service connected. That's the question there. Doctor, do you have anything on that?
That's a good question. I have to admit to not knowing enough about this because COPD is more like pulmonology, so lung doctor.
Absolutely.
I think a Nexus letter would help a lot probably, but I don't have enough.
Yeah, so to give you an answer, John Johnson, it comes down to two things. One, did you talk about your like bronchitis or something like that? Did you talk about that in service? Okay, did you have that in service? Was it a recurring issue? What's your medical evidence look like? I'm going to assume none, right? That's the most common thing I see in veterans is we have no medical evidence. Because if you go to medical, now it's like, oh, there goes Clay, he's always at medical, right? And you drop your pack, someone else has to pick it up. So there's a reason veterans don't have medical evidence. That's why. I'm going to assume you don't have none. And if you don't, you are 100% absolutely going to need a Nexus letter. But then again, the doctor who writes that Nexus letter is going to look at your evidence, which is non-existent, right? It's going to be hard to link that diagnosis to service unless you have something there. Something. Even getting bronchitis once would be something. That's not a lot of something, but at least it's something, okay? So that's the question there. That's definitely not a good situation. All right. Peter Perez, hey man, thanks for coming. Appreciate it. All right, LG, can you receive compensation for degenerative changes in your back, knees, and ankles? There's definitely, if you have anything on non-mental health issues, please feel free, Doc, to chime in. When it comes to your back, your knees, and your ankles and degenerative changes, there's degenerative arthritis, okay? You can absolutely be rated for that. You can be rated under pain, and you can be rated under range of motion. Those aren't three separate ratings. Arthritis might be, depends. But pain and range of motion are usually in one rating. And so the answer to your question is yes. My question to you is, what's your medical evidence say, right? Have you been talking to your doctor about your back, knees, and your ankles? That's the question. When it comes to those being linked together, Your ankles can cause knee issues. Your knee issues can cause hip issues. That can cause back issues. So that's all there. The secondary argument is there. It just depends on what your evidence looks like. All right, willpower. Only spoke to a mental VA specialist recently. Extremely emotional conversation. Yep, absolutely. I'm going to scroll down and see if you said anything else, Will. But hey, man, I've been there myself. Totally agree with you. There are a lot of questions. Okay, yep, willpower. Thanks for sharing that, brother.
Thank you.
Yeah, thanks for sharing that. Keep going, okay? If there's a need there, seek the care. If you have a disability question, let us know. And especially Dr. Sharma, you know, that's what this live stream is for. If you guys need help, let us know. That's the only reason we do this, right? Yeah, Greg Schultz, he said LMAO, Randy, that's right. Mario, share the stream. Absolutely, guys. Hit like, share the stream. As genuine as I can possibly be, we just want to help veterans, right? This is not for-profit company stuff. We just want to help veterans. That's it. All right. Angie Gross, maybe Gross. I'm sorry if I said that wrong. Anxiety and depression and secondary GERD, IBS, insomnia, fibromyalgia, and migraines. Okay? That's a lot. Seems like a lot, but is there a limit to the number of secondary issues that can be linked to the anxiety and depression? You know what, Angie? That is a great question. All right. Is there a limit to secondary issues that you could write it? Let's say Angie comes to you, doc, and she wants to write a Nexus for 20 different conditions secondary to mental health XYZ. You know, choose your disorder. What's your response to that?
Yeah, it's a great question. So there's no number that I know of, but it all comes down to overlapping symptoms, right? Because the VA is going to argue that, hey, you can't separate these symptoms because there's so much overlap, so it's all going to be from this condition, right? So, for instance, like, let's going from that list, like, those are fairly differentiated. I think there is overlap there between insomnia and fibro, and then there's overlap between migraines and fibro. So what's going to happen is there's going to be overlap, and then the VA is going to say, there's not enough evidence that you can separate these two diagnoses, so we're going to give you this one. Absolutely. Yeah. So, you can still go for the well-differentiated ones, right? Like the IBS is well-differentiated, fibro is, and choose a few at a time.
Oh yeah. Anxiety, depression, and insomnia, that's all rated under 1.
Oh, yeah.
Because the VA, it's weird. What I'm going to say is going to sound weird, but it makes sense if you don't think about it. That makes sense if you also don't think about it, right? But the VA rates symptoms, not disabilities, okay? So anxiety, depression, insomnia, they all share the same symptoms, right? You're going to be irritable if you can't sleep. You're going to be irritable if you're depressed and something ticks you off. You're going to be more prone just to be irritable. That would all be one symptom of all three of those. So that's why that's lumped together. Fibro, migraine, same. I think you could draw a distinction between the two, depending on the symptoms. Migraines is a solid, it's a what I call a big ticket item for claims, right? Anything that's 50%, anything that has a percentage of 50% or above, I think is worth fighting for, right? Versus like a 10%. Like, am I really going to pay for a Nexus to get a 10% rating? Are you? Are you trying to fight for tinnitus? Because if you are, well, does your tinnitus cause migraines? Does your tinnitus cause anxiety? Then that would make the 10% worth it. Versus the opposite, right? Hey, do you just have tinnitus and that's it? I don't think. You have an 81% VA disability. You fight for tinnitus. Now you have an 83% VA disability. At the end of the day, you have 80%, right? Nothing changed. GERD, IBS, yeah, that's a great question. Okay.
Yeah.
Moving on. Brian's W78. Brother, I remember your name from last time. Thanks for coming back. All right, thank you for these live chats. I separated from the U.S. Air Force April 94. That's all up in your alley. I was recently diagnosed MDD. Is that
Major depressive
major
disorder?
depression disorder, right? And general anxiety by the VA, okay? My family has told me that they noticed changes in me while at first duty station. Oh, this dude. Okay, I remember. He asked me this question last week, and I told him to ask it this week. Okay.
Oh,
So he has. There's 3 chats. I'm gonna read them all. So, recently diagnosed with MDD and general anxiety by the VA. He left in '94, so there's a time gap there. His family told him that they've noticed changes since '89, '92. Okay. I noticed what I now understand may have been depressive symptoms while stationed at Shemya, 92, 93. Is it possible to prove service connection at this late date? There were a couple events at Dover that affected me and did receive alcohol counseling at. I do not have any in-service records for MDD or general anxiety. I'm assuming that's what he's talking about. Okay, that's a mouthful. What do you got on that?
yeah, it's a great question. So, it's helpful that your family noticed changes. So that's going to be a good thing right there. We can use that, and then uh, uh, the other thing that you mentioned is that there was events that happened at Dover, right? So it would help. If I were to talk to you, I would go through those events with you in detail, and then if we can get any of the records from the alcohol counseling, that would help because a lot of times, you guys probably know, but alcohol is used as self-medication, right? And there's tons of studies and literature that shows that alcohol is used as self-medications, even studies specifically on veterans and military. So that would also help. So if I were working with you, I would probably want you to get a supporting statement from your family, and then hopefully we can get that alcohol counseling records. It might be difficult. I know that was a while back. And then I would get some more information from you about those events that happened at Dover, and go from there.
All right. Yeah.
So I'd tackle it. I would say that it's going to be an uphill battle, but we can tackle it. Try to look for different things.
All right, that's a great answer. I love answers. One of my favorite ways to answer a tough question is saying, "Hey, just so you know, this is a battle." Okay, yes. It's good to know that because are you committed to that, right? Just as like Dr. Sharma is committed to writing that Nexus, you would have to be committed to give Dr. Sharma what you need, right? So you need medical records, like you need evidence to write your Nexus letter, and that takes a lot of work. There's a lot of self-responsibility there. So that's a great question. All right, LG, if granted 100%, can my spouse use school benefits if she's in the military? I'm going to add 100% P&T to that, or TDIU, okay? But 100% combined, no. But the other two, yes. Your spouse can use that. There's nothing in the Chapter 35. That's what the dependent education benefits are. There's nothing in Chapter 35 that I know of that says if you're active duty, you can't use it. All right, but your spouse also has tuition assistance. Okay, so depending on what that situation looks like, that's something completely different. Or your spouse could be a reservist and doesn't have tuition assistance, right? Then they could tap into the Chapter 35. All right. Next level cash. Dr. Sharma, can you describe your background and what services you offer? Is it just Nexus letters, DBQs? Do you offer mental health diagnosis? What do you do? That's a great question, Next level cash. Yeah, he's a long-time viewer, so appreciate that. All right.
Awesome. Thanks, Next Level Cash. Appreciate it too. Yeah. So basically, just for the folks who have joined, I was a flight doc in the Air Force. So I did that for 4 years and then got out and came to psychiatry residency out here in Baltimore at Johns Hopkins. And after I graduated from there, I started doing regular psychiatry, so inpatient, outpatient psychiatry. And then I started doing Nexus letters and DBQs, got into this whole thing. So I do Nexus letters, DBQs. I can do mental health diagnosis. So I've had folks, veterans come to me before where they're like, I just don't know what I have. Like I just, I need some help with figuring out what my diagnosis is. Can you look at some of my records, and then we do an evaluation and you tell me what I have? Yes, and I can do that as well. The only thing I don't do right now is I don't do private practice treatment, so that's the only thing I don't.
All right, no, solid. I do want to add to that because what you offer goes into why a veteran would even talk to you in the first place, right? So there's a few. If your disability claim does not have all of these, it will be denied, right? You can't have some of them. You can't have 3 out of 4. You have to have every single one. You need an in-service event, meaning it could be something as generic as, I had migraines when I came back from my deployment. All right, in-service event. It could be something specific like, on this day, I fell off a truck and broke my back. Boom, in-service event. You fell off a truck. You need a current and chronic. VA loves the chronic word, okay? Current and chronic diagnosis. So if you were diagnosed with knee pain 20 years ago and have no medical evidence, 20 years later you try and file a claim for knee pain, the VA is going to argue you don't have a current and chronic diagnosis, right? So in-service event, diagnosis, and then the other two you can kind of rope together. It's service connection and a nexus. So when you submit a disability claim, the C&P examiner is going to determine service connection, and they will write a nexus statement, right? Less likely, at least as likely, or more than likely. The C&P examiner will do that. And basically what Dr. Sharma does the same thing, except the bias is not there, okay? I don't want to take a dig on C&P examiners, but let's talk generically. Okay, they want a government contract. Okay, the government pays the lowest dollar, so you get what you pay for. Basically, I think that's the nicest way I can put that. If I was to get a Nexus letter again, I'd go to the top dog. Right, I want a psychiatrist for my mental health disorder. I want a physician for my back. Right. Okay.
And that's and thanks for mentioning that. That's the thing about when I write a letter. I spend an entire day on a letter. It's not that, somebody doing a C&P exam, let's say there's a nurse practitioner doing C&P exams.
Exactly.
He or she.
Exactly.
Yeah, he or she might be seeing like 12 veterans a day or something, and just like churning through. But for me, like I see less people, so I can spend more time, And
that's something I didn't think about. That's a great topic for a video. I'm definitely going to add one day. But you're right, nice. Right? How many times has everyone in the chat, if you've been to a C&P exam that lasted 15 minutes or less, let us know in the chat. Just put 15 minutes or less. When we get to that portion of the chat, we will remember this conversation, all right? But yeah, let us know. That's a great point. I'd never even thought about that. All right, moving on to Devin Duncan. I'm currently in a service-connected med process. That's being medically retired, okay? I have less than 15 years in the Army, National Guard. Altogether, I have 90% rating, but 70% PTSD rating. Would I still get medical retirement? Do you want to chime in on that?
Oh, shoot. I actually don't know.
Okay.
Sure, yeah.
So MEBs are, I want to start this with extremely confusing, okay?
Mm-hmm.
Your one point of contact is your Peblo, and just like they're people, there are good Peblos, there are bad Peblos. But your question really is, do you still get the retirement? So you have less than 15 years, Army National Guard. No, you would not. Okay, there are certain waivers, and I believe, fact check me on this, but I believe like if you're at like 14 and a half years on active duty, and you're medically retired before 15 years, you can get that last 6 months waived. I do not think that's the case for National Guard, right? Because they're going to take into account your active time or your pointed time, and I don't think that's the case. Fact check me on that. I'm not 100% sure. I'm pretty sure, but yeah, I'm going to say no, but definitely fact check me on that. In fact, Devin Duncan, send me an email, TheCivDiv@gmail.com, and I'll get a final answer, but I'm pretty sure that cannot be waived. All right. Valhalla BJJ, another question. How much medical proof is there that PTSD that Hey, I think we answered that one already. Maybe a retype. But yes, you can prove PTSD to GERD, right? It's
That's
there.
right.
Not as strong as IBS,
Mm-hmm.
but definitely still there. I did not know that. So I didn't know that IBS was a stronger case.
Mm-hmm.
Okay. Robert Hayes, USMC 90 to 94. Yut. What's up? If I see him reading the chat, I just gotta let them know. All right. Hurt your back and knee. 40 for back, 20 for left knee. Okay. Have diagnosis. SA. I'm assuming that's sleep apnea. Also, while in was put on profile for weight gain after knee injury, looking for sleep apnea secondary. Okay, so you have sleep apnea diagnosed. I'm assuming that's what SA means. You have this knee injury, you have this back injury that are service connected. Can you secondary sleep apnea to those? Do you want to take that, Doc?
Sure. Yeah. And left knee, and then put on profile for weight gain after knee injury. Right. Okay. Okay. So that profile and all that information is in the active duty medical records. So we can get that and we can work through it and say, okay, this weight gain occurred. Yes. So that can be done, but I would have to kind of do some more research on this. Okay. So this is one I haven't run into. So what I would probably do is look through the files. As you guys know, like I look through the files first before I do anything else. And then I'd probably look at past cases and what has been approved, what has been denied with this. Because sometimes it's tough with the weight gain aspect on what the VA will give and not give. So I do some research.
Yeah. I do want to chime in on that. The good things I see about this case specifically is you have evidence of weight gain. Weight gain is definitely there for sleep apnea. I don't know the medical stuff. I just know it's there. Okay, so that's a good thing. In terms of disability claim, not in terms of your health. So that's in your records, which is good. My second question is, and this is more of this is a genuine question. I really don't know, Doc. Would his route would that be a better route with like a physician because it is connected to back and knees, or would that be better connected to like a psychiatrist? Like what, or is it the same? I guess because the conditions matter, right?
Yeah, no, great question. And I was thinking that, and I forgot to mention it. If you wanted to get a letter for this, I would go to probably an orthopedic specialist, right?
Yeah,
so,
absolutely.
Yeah, exactly, because that specialist can then say, yes, knee injuries very commonly do this, and this is what the records show.
Absolutely, right. Okay.
Yep.
Another thing, Robert Hayes, I'm going to bring in is just on the opposite side of that coin, right? If your back condition causes you to be depressed, then maybe I would definitely recommend Dr. Sharma, because now we're talking mental health. So really be aware of who you're getting the Nexus letter from. Okay, but yeah, we have a $10 donation, dude. Thank you so much. Just so everyone in the chat knows, all the money from this stream goes right back to the channel. No profits made at all. If you're in here, Orange Remediation, he donated a lot of money last week for a wireless keyboard, which I did buy. I didn't set it up, though, but it will be set up the next live stream, so I appreciate that. Thanks for $10, brother. Appreciate it. Awesome. Okay. All right, Secret Sauce, I love your name. All right, I was diagnosed with an adjustment disorder while on active duty in 2014, which still has affected today, including being homeless for years. How can I prove this claim to the VA? All right.
Yeah. No, that's a great question. Yeah. So basically, so there are those records that show the adjustment disorder, and then my question is, have you gotten care over time? Not like every single month or something like that, but have you gotten care over time that shows that this has been affecting you over time? That would be my main question.
Yeah, absolutely. Anytime, as I look at questions, I kind of dissect them, right? The first thing I look for is time, right? Has there been a gap? Okay, there is a gap. Not the end of the world, right? And then it leads me to another question, right? Hey, what's your evidence in that gap? Were you being seen as time went on? If the answer is no, again, not the end of the world. It's not good, right? But it's not over either. So I guess to answer your question, secret sauce, is to what's your treatment like from 14 to now, and then or another route you could go is if you could prove your homelessness from 14 to now. That could also be another route, right? Having a lack of healthcare specialists available to you, that could also be another route.
Oh, great point. Yeah. Yep.
All right, USMC, Big B. Yep, see, he said Simplify, brother, to the dude that said he was a Marine. That's what I'm talking about. Okay, Stephen McNett. We have legal custody of our granddaughter, no contact or money from parents. Can we get the extra money from the VA for her? If so, how? So he's talking about dependents. Legal custody, yes, you can. So it's weird. When it comes to as long as the dependent is in your home, you can claim that dependent, right? So if it's a stepchild, as long as the stepchild's in your home. Now, in your case, it's your granddaughter, but you have legal custody of the granddaughter. No contact money for parents. First, I want to know, does she live in your house? I'm assuming she does, right? Because you didn't say she didn't. But answer that first. If she lives with you, yes, you can claim her. How do you do that? You just go to va.gov and add her as a dependent. That's it. It's that simple. Adding dependents are super easy. You know what? In fact, I'm going to have a video come out. I just had a daughter, Dr. Sharma. I don't know if you know that or not. I had a daughter. She was in the NICU for a while before she came home for Christmas, and we just got her birth certificate and her information in the mail. And so now I'm going to add her as a dependent, and I might as well record that video, right? So stay tuned for that, Stephen McNett. I'll walk you through the process on how to do that. But it's pretty self-explanatory. If you go to va.gov, it's very easy to add a dependent. Yes, you can do that.
Congratulations.
Yeah. Thanks, appreciate it. Greg Schultz, hey brother. Glad you could make it for the 7 p.m. Yep, Simplify, Big B, and Robert Hayes. That's right. Stick together. All right. How fast is the current turnaround time on Nexus that you write? This is a specific question to you from John Johnson. What do you got?
Yeah, good question. It's pretty quick. So I see few veterans every week, and so I try to write the letter within, let's just say, I'll be pessimistic and say within 3 days of when I see you. Okay, so my process is first you reach out to me, we do a phone call, we talk about your case, then I look over all your medical records. You don't pay anything, right? I look over the medical records. Once we confirm that, then we schedule the video evaluation, and then I'll get you the letter within a few days. So it's not too long.
Yeah, that's a great question. And again, guys, for those of you just tuning in, one thing that drew me to Dr. Sharma is he will review your evidence and give his opinion if he can help or not. Mm-hmm. And before you charge, right? Which is huge. I can't tell you how many Nexus letter companies were to say that really, saying, hey, you know what? This probably isn't going to work, but you owe me $1,500. And I'm just like, dude, what? You said it wasn't going to work, right?
How do they sleep at night?
Yeah, I mean, I guess they sleep, paying off those school debts, right? Okay. All right, Next Level Cash. He says, I wish I knew I had to pay up front to look over my records. Then if they see something, they offer a Nexus letter fee. Yeah.
Yeah.
Absolutely. All right, Paul Tamor. I'm sure I butchered that. I'm just going to call you PT. PT, I got out 13 years ago. My medical records don't have much in them. Absolutely. That's probably the most common thing I see in every veteran's case that I look at. I try to have a meeting with 2 or 3 veterans a week. So if you want me to look at your case, send me an email at TheCivDiv gmail.com, and we can go ahead and get that scheduled. Right, all free. I don't charge for anything. Okay, so Paul Timor has 2 deployments. Was hit by an IED. Headaches were denied as service connected. My CMP was supposedly done in Pennsylvania, but I live in LA. Is an appeal in my future? I have lots of questions. Okay, one, I want to know everything you filed for. Every single thing you filed for, because there's a lot more than migraines that you could probably claim. I'm saying that without looking at your medical records, but being in the infantry myself and having a lot of friends with similar experiences, you can probably claim more stuff. So I want to know everything you claimed. I want to know if you were given any award when hit by an IED. Like, were you, in the Marine Corps, you would be given a combat action ribbon. Were you given like a combat infantry badge or the CAV, whatever? The Army has 2 different ones. I don't get it, right? Let me know your awards for that in-service event. That's an in-service event, so we got that check marked. Okay. I want to know what the treatment was post-IED blast, right? Were you seen by shock trauma platoon while you deployed? Did you go to, do you have a Purple Heart and you were medevac to Germany, right? There's a lot of questions I have for that. Is an appeal in my future? To answer your question bluntly, absolutely. Okay. It sounds like you have the evidence, but there's a lot more to that. Okay. So I definitely want you to send me an email to TheCivDiv@gmail.com. I have tons of questions for you. All right. Valhalla BJJ. How much medical proof is there? Yep. We got that one.
Double.
Yeah, we got that one. All right. How much is the charge for a Nexus letter? You know what? This is the first time this stream someone's asked this. Dr. Sharma, go ahead, take it away.
You got it. Yeah, this is a good time to talk about so what I do. So with what I do a Nexus letter, which is also called an independent medical opinion. That's what the VA calls it technically. So I do that Nexus letter and the DBQ. And I will do DBQs for each diagnosis that we're doing. Okay, so everything's covered. I don't leave anything out on that. And then my Nexus letters are, so I've got one pulled up right now. They range between 9 pages and this one is 16 pages. So they're very in depth. To give you the different sections, I do an introduction. I have the diagnoses, I have my qualifications, I do a summary of my opinion, if they just want a paragraph of what I think. I do a medical analysis where I summarize all your past relevant medical records. I describe the evaluation, so how it went when I saw you over video, right? I describe that each detail there. And then I have a medical literature section where I put the studies, right, that back up my claims, that let's say IBS secondary to PTSD, how am I going to prove that, right? Like what's the literature? I have that. And then the last section is summary and rationale, where I sum everything up in one page that has everything if they just want to read one page, right? So that's everything. And then the DBQ. My price range is from $695 to $995, right? Now, a vast majority of the time, it's $695. I can tell you right now. Usually, it's only when where we have like a lot of conditions that I'm raising the price. That's for the letters that'll take me a couple of days to write. So yeah, that's my sort of I guess fee schedule.
Yeah, and I want to give people. I'm going to give veterans out here some comparative analysis, right? Because on average, I think I would make an argument. I haven't done a study or anything, but on average, I would say the going rate is about $1,500. It ranges from $1,200 to $1,500, usually for a Nexus letter. And again, going back, this isn't a dig on psychologists, okay? If you're going to pay $1,500 for a Nexus letter for a mental health condition, why would you pay that to a psychologist versus a psychiatrist, right? Which is higher on that totem pole. And so one thing I respect you for, doctor, is you are a psychiatrist and you're below the average, right? And I thank you. I'm sure everyone in the chat thanks you a lot for that. So yes, that's the price. You said $695 and $995, right?
That's right. Yeah, and vast majority of the time it's $695. So,
all right, awesome.
Yeah. No, and thank you for saying that. It's and I really enjoy doing this, So yeah, I'm in it.
All right, Super Haram. That's a hilarious name. Okay. What's the difference between getting 30% and 50% for migraines? So I'm gonna challenge you, Super Haram. My mission is to inform the veteran community, right? So I'm going to teach you how to fish here. I want you to Google migraines 38 CFR. It's going to pop up. You're going to see 50, 30, 10, and 0. One of the main symptoms for 50% rating for migraines is economic instability, meaning your migraines causes you to miss work, you're taking 6 days, you're out of sick days, so now you're using PTO. You're out of PTO, so now you're pay time off. So now you're literally missing work. Okay, that would be economic instability. And then 30%. There's a key thing. There's two key things in migraines. People say prostrating migraines is one, which it is, right? Which means it's so bad you have to lie down. You can't do anything. That's basically what prostrating means. The other key thing to a 30% rating is it's over time, and the 38 CFR says several months. So if you have prostrating migraines 4 times in 1 month and you submit that disability claim, the VA is going to give you 10%, right? Because legally they have to. But if you have the intent to file, maybe you wait a little bit, 3-4 months goes by, 6 months goes by, now you have prostrating migraines over several months, you get that 30%. Once your prostrating migraines hit economic instability, that's the difference between 30 and 50. Do you have anything to add to that, Doc?
No, that was perfect.
Yeah.
Yeah, and I frequently pull up 38 CFR, to look at this too. Yeah, absolutely.
38 CFR is, if I will tell you this, for those of you that watch other YouTubers, or you're in Facebook group for veterans or the Reddit or whatever, if anyone gives you advice that is not the 38 CFR, just discount it. It's bad advice, okay? I would make a bold statement by saying that, and I'm going to die on that hill, okay? Every decision the VA makes is by 38 CFR. Okay. By BBuck 2003, personal experience. I believe this gentleman requested your services, right? Yeah. He says Dr. Sharma is awesome, easy to work with, very patient, excellent letters and DBQs. Hey, appreciate that. I'm sure Dr. Sharma appreciates that. Go ahead.
Thank you, BBuck. Yeah, thank you, sir. Yeah, that's I love it, and I'm glad you liked what I provided.
Yeah, BBuck, I want to challenge you, brother. Let me know after you submit your claim with your Nexus. Let me know what the decision is, right? Because if we can connect Dr. Sharma's amazing Nexus letter to a favorable VA decision, let us know. Come back with that, and I think that would be a great assessment just to let everyone know, saying, hey, Dr. Sharma is not full of baloney, right? He's actually a psychiatrist, believe it or not, okay? All right. Lee Garrell, another longtime supporter. Hey, he says, Brother Clay, got my scheduled BVA appointment on the 15th of March. Took me a second there. After 4 years of waiting. That is insane. 4 years waiting for an appeal. Oh, the Board of Appeals, okay? That makes more sense. You, my brother, have helped. Thank you for educating me. I will keep you updated on the outcome. Yep. Hey, appreciate it, man. Please do. Board of Appeals is very tricky. It's the only time I recommend veterans to get a lawyer, an attorney, an accredited VA attorney is when you're going to the board. If you're just submitting claims or a supplemental appeal or a higher level review, a lawyer is not needed. They actually won't do anything, to be honest with you. But if you're going up to a board of appeals, that literally means you're talking to a judge. Divorce lawyers get lawyers when they go through a divorce. I think veterans should get lawyers when they go to a board of appeals, right? Okay. Dims. Hey, Dims is back. All right. Okay, thanks. I thought insomnia was the mental health under this. Nope, you're right, Dims. You're right. Insomnia is. We answered his question way back, right?
Yeah.
Insomnia is rated under anxiety, depression, because they share the same symptoms. Okay.
Correct.
All right, Randy Marsh, South Park guy is back. Appreciate it. Okay, I have been diagnosed with severe depression. Okay, it's different. Severe depression is a little different, okay?
Mm-hmm.
I am unable to hold a job, all right? You were a corpsman working in labor and delivery. I witnessed a lot of death, either baby or mother. How successful can I claim be? Okay. That hit, dude. That hit.
Wow.
Yeah,
Wow.
that's one, thank you for your service, bro. That definitely, it's a sticky situation. But Doc, you got anything for that?
Sure. Yeah. Yeah. Thank you for your service, and sorry this happened. And yeah, like if you want, you can contact me. Like what I would do is, again, I would talk to you more about the case. Obviously, as a corpsman working in L&D, labor and delivery, I think that occupation, right, is there, and we can make a connection there. So, I would say that there's a good chance, and even more so if you know, it sounds like you do have this the record of you being seen and treated over time. Or over some amount of time since you do have the diagnosis of severe depression. So it sounds like you have that. So I think this has a good chance.
Yeah, some good things I see in this from a claims perspective.
Mm-hmm.
I see an in-service event, right? So that checks one box. I see service connection. Depends on what your evidence really is for that, right? I want to know, did you get diagnosed in service? That would be the best option. That would be the best case scenario, right? I'm assuming that's not there, so we might be missing that, which is where Dr. Sharma could come in, fill that role, right? Establish that service connection. I see a current diagnosis, current and chronic. That's important. And then definitely there's probably some symptoms there just from looking at this paragraph. But yeah, absolutely. All right. Gary Went. Sure, I butchered that one too. All right. Is the doctor from the Florida area? My doctor is named Dr. Sharma. Where are you at?
It's a good question. I'm in Baltimore, Maryland.
All right.
Sharma is a really so I'm from Nepal, and which is close to India. Sharma is like the Smith of Nepal and India.
Oh.
So we got a lot of Sharmas running around.
All right. Fred Christie, is heart conditions covered under Gulf War presumptives? Some are. It depends exactly what your diagnosis is. But if you Google PACT Act VA, you'll get like a PACT Act fact sheet from va.gov. Click that link, and the VA kind of separated it in eras, right? So there's a Vietnam era. If you're in Vietnam, you click that section. If you're Gulf War presumptive, click that section. And then you can go ahead and see all the conditions that are listed. There are some heart conditions. I don't know off the top of my head. What I really want to know is what have you been diagnosed with, right? A heart condition is not a diagnosis. I want to know specifically what you've been diagnosed with, or if you're not diagnosed, what are your symptoms, okay? A follow-on question to that is, have you talked to a doctor, right? I'm always going to push the doctor side, okay? Me, Clayton Sims, in my wonderful basement down here, I cannot diagnose you by any means, right? All right, Philip Castro, hey, brother. What's up? Definitely a long-time supporter here. Just got on. How can I contact the Dr. Sharma? I like how you said that. As I have so many denials on my cases and really need someone to guide me from PTSD. Have seen 4 different, as they're all the same, denial comes. Okay. Definitely. Actually, Dr. Sharma, how can veterans get in contact with you?
Sure, yeah. So my website, concisepsych.com, which is in one of the corners up here. And then it's my first name dot last name at concisepsych.com is my email. But if you go to concisepsych.com and you click on the veterans section, you can click learn more where I have the veterans statement there, and you can submit your information there, or you can email me from there. So
yep. I just put your email in the bottom of the chat, right?
Awesome.
So prashant.sharma@concisepsych.com.
Perfect. Thank you.
All right. Donald Hudek, see the VA doctor annually for all 3. Okay, you definitely asked a question earlier. But you have, I'm assuming you have, so that establishes a medical trail, right?
Yes.
That's good. I'm trying to scroll up.
He was the neuropathy with the angina.
That's right.
Yep.
Okay.
Yep, that's good.
Yeah, so if you remember what we said before, all of that definitely applies, but you're definitely going to want to see a specialist in that. What doctor would that be?
Uh, so for the
Like
neuropathy or
pulmonary? Yeah, for the neuropathy, right?
for neuropathy, it would be a neurologist.
Neurologist.
Yep,
Okay,
you
yeah,
got
yeah.
it. Hmm.
But hey, but what I see from a claims perspective is there's a medical trail. You have diagnosis. Um, yeah, so you have things going for you as far as VA claims go. So yes, that's good. All right, super haram. Shout out to all my fellow Bellwoodsmans. That's right, dude. He's a yut, right? Okay. Nayo, just to give you an update, I got service connected for sleep apnea secondary to my PTSD. Hey, there we go.
Nice.
I do want to chime in on this one because if I was to take a poll on how many veterans were successful at connecting sleep apnea to PTSD, it would probably be 50-50. There's so many things that go into sleep apnea secondary connection. I wouldn't say it's hard, but I wouldn't say it's easy either. It really depends. Your medical evidence is going to be king here, right? Do you have anything, like if you're writing a Nexus sleep apnea secondary to PTSD, what are some things you're looking for?
Yeah, so it goes back to that. I would look for more factors than PTSD because, like, we want to have a really good case, when we submit it, and I don't want the VA to push back because it's so hard. Like, I feel like it's a bit hit or miss with OSA, sleep apnea secondary to PTSD.
Oh
Um,
yeah,
it helps if you've been deployed to Iraq, Afghanistan, Kuwait, one of these places. It definitely helps because there's a study showing an association between veterans coming back from these places with PTSD who have sleep apnea. It's just that the VA regards it as an association instead of a causal effect, right? Now, don't get me wrong. I do believe there's some issue there because you have all these young guys and gals coming back from these places who are not obese or anything, and they have sleep apnea, right? And they
yeah.
have PTSD. There is something there. They just don't know what that is yet, like firmly. So sorry, I skate around this one a little bit. That's
No, it's
because
it's it's it's
yeah,
warranted. I also want to. I'll be the bad guy in this scenario, right? It also might not just be connected, right?
yeah,
You leave service and you stop going to the gym. 15 years go by, you gain weight. Now you have sleep apnea. Maybe it's because you've have an unhealthy lifestyle comparatively from when you were in, right? That could also be a reason, right? So when the VA denies sleep apnea, I don't want you to get the picture like they're the bad guy, but it's always going to be, it's not guaranteed. Okay, I guess would be the best way to put it. All right, Lee Garrell, yeah, I know. Let's kill the mood, right? Okay, Lee Garrell got a great IMO for my last CMP examiner for insomnia, right? Exactly. CMP examiners write a Nexus statement. That's something that a lot of veterans, I think, just don't know. But they will write a statement and they will establish service connection. That's going to happen.
yep.
All right. Waiting on the decision. Hey, wishing you all the luck, man. Wishing you all the luck. All right. Brian Green, just for more info. This was actually the very first question we answered, if you remember the sleep apnea one.
Oh,
He came back, right? Thanks for coming back. Appreciate that. So just for more info, 70% PTSD, 10% tinnitus, 10% hypertension. I'm assuming that's what that is.
yep.
0% hearing loss, have current diagnosis June 22nd. Secondary to PTSD, no need or do not need in-service event. Okay, yeah. I guess for that, yeah, it goes back to what Dr. Sharma just said, right? You have multiple factors. So PTSD could be one. Here's a question, Doc, and this is a genuine question because sometimes this comes up. I have a hard time answering questions that's like, hey, I have insomnia, I have tinnitus, I have sleep apnea. How can I get them service connected? And the problem that I struggle with, right, is insomnia keeps you from sleeping. but when you do sleep, you have sleep apnea. So it's like, do you understand that argument? Like you're saying when you do sleep, it's hard for you to go to sleep, but when you do, you have sleep apnea. And is there an argument the VA is going to kick back on that? Because it's like, how can someone have both? What does that look like? How do you function, really?
Got it.
Right?
Yeah.
Like, how do you function for a month having sleep apnea and insomnia? How does your body physically get through that without, like, a high dose of Adderall every day? Like, how does that happen, right?
Yeah, no, that's such a good question. It's a terrible combination, right? And yes, you can have both. I've seen it where folks have both, and it's terrible. And there's different types of insomnia, right? So there's where you have trouble falling asleep, staying asleep, or both, right? And is it primary? Is it secondary? But it's a terrible combination because you have trouble falling asleep, probably. And then you have sleep apnea, so you're not getting restful sleep, right? And then you might be waking up and you're almost never going into REM sleep, right? So the entire sleep architecture is messed up. So this is where when somebody does have both, I bring in something called the Epworth Sleepiness Scale. Don't worry about the name, but it shows us, like, in daytime situations, how often do you fall asleep, right? Like, when you're sitting and reading, when you're sitting and watching TV, if you're sitting and talking to somebody, right? Like, do you fall asleep, right? And so we add that up and we say, all right, is this mild daytime sleepiness, moderate, or severe? And then that tells us the extent to which this insomnia and sleep apnea is working. We can't say obstructive sleep apnea is secondary to insomnia because, exactly like you were saying, Clayton.
Yeah,
like,
there's an argument, right? Yeah.
Exactly. Yeah. So you can't say it's secondary. Obstructive sleep apnea can certainly cause insomnia.
Yeah. Oh, yeah.
So that can certainly happen.
All right. So I do want to address something with you, doctor. It's totally, do not feel obligated, okay?
Oh.
I want to give you some stats right now.
Yeah.
So we haven't dropped below 77 viewers this whole time, which is amazing, okay? So that's double what I usually get. So I appreciate you coming on the show. It's 8:23 right now Eastern time. What I'm going to propose is 9:30. So in an hour, we dead stop. Does that work for you?
Yes, that
right,
does.
Because that'll be a 2.5 hour stream. Okay, guys, you heard it. 9:30 Eastern, dead stop. I made the mistake of scrolling down, and there's a lot of questions. All right. So we're gonna try our best, everyone, to get through these. We are genuinely here to answer questions. That's what this live stream is for. So let's get back to it, right? Teat on JJ, hey brother, thank you, longtime supporter. Appreciate you coming back. HP Power, I'm currently rated for hypothyroidism, now treated for depression. They said it's commonly related. Okay, I think you're implying your question is can you claim depression secondary? Doc, go ahead and take that.
Yeah, great question. And yes, you can, right? And so hypothyroidism, you think about it as, the simplest way I think about it is that it slows the body down, right? So it slows your metabolism, you gain weight, it slows your thought processes, you have difficulty concentrating, it lowers your mood, right? It does all these things. And we can make an argument for that, that hypothyroidism is aggravating or even causing the depression, especially if the timeline matches, right? Like in terms of the hypothyroidism. And, even if your thyroid function is under control, like your TSH level is normal, it can still impact your depression, right?
Oh, yeah.
Studies have shown that. Yeah. So, yeah, you can, is the short answer.
Yeah.
Yeah.
Real quick, Greg Schalt donated $20. Dude, every time someone donates, I swear I hold back my tears. I swear to God. But all money goes right back to the channel. Not joking whatsoever. My wife and I are very blessed. So all donations go back into the channel. I'm trying to grow this, and my ultimate goal for this channel is to disrupt the market for for-profit companies. Okay, that's my goal. I don't care how that gets done. I'm just trying to disrupt that market. And, in a perfect world, there wouldn't be any VA Claims Insider. There wouldn't be any vet claims consulting companies taking advantage of veterans, right? That's the goal of this channel. So, brother, I appreciate it. That will definitely be put towards that goal. So, Brian Green, back to the sleep apnea question we had at first, he added some key information I really want to hit on. He said should be, so you're service connected for PTSD, aggravation, your sleep study's done, you've been on CPAP for 8 years, okay? And so now that time gap that was there, now you're saying sleep apnea, you've been diagnosed in CPAP for 8 years. So I think it's still not a guarantee, right? But the shorter the time gap is, I think the more likely the VA is to agree, hey, your sleep apnea came from, right, this deployment from your PTSD, XYZ that Dr. Sharma had hit on earlier, right? So time matters. Time definitely matters. Do you have anything to add on to that?
No, you got it.
Yeah, all right. Slick the Ripper, love your name, brother. All right. I love reading YouTube names. It's hilarious. All right, where can I find a template for bilateral knee pain? Nexus. My doctor said I'm her first veteran. I'm so glad you said that because I have a solid question for you, Dr. Sharma. Slick the Ripper, I hope you're still tuning into this because I want everyone to listen to this carefully. And I want to ask Dr. Sharma, what makes a good Nexus letter?
Yes.
And I'm not talking about specific diagnoses or psychiatrist, physician, just a good Nexus. What makes a good Nexus letter?
Yeah. So it's got to have a few different components, right? So it's some of the stuff that we talked about in terms of the expertise, right? So first of all, does that doctor, physician, whoever have expertise in that area, right? So if you're getting a PTSD letter, right, is that somebody in the mental health field, right? So and like you said, it helps if it's somebody who has that credential, like psychiatrist, something like that, right? Now, the next part is, did that individual review your records, right? Did they review Did they review your medical records? Did they review your C file, your current disability ratings, whatever, right? Did they review all that? Because if a doctor talks to you, right, and doesn't review anything from the past and writes a letter, then that would just be like a one-time evaluation, right? There's there's no past evidence right there. So you got to make sure that person's reviewing things. Okay. Okay, qualifications. I'm looking at my list right here. And then it's the verbiage, right? You got to have that verbiage down, right? So I'll give you an example, right? So based on the analysis herein and corroborating evidence, it is my expert opinion that it is more likely than not, and in fact, highly likely, that the veteran's major depressive disorder is related to and proximately caused by his service-connected lumbar spine and bilateral radiculopathy. Lumbar spine pain, sorry. So that's the verbiage, right? And there's different levels of that too, right? So if I'm doing a letter, I might say as likely as not, or more likely than not, or highly likely. There's different levels of confidence, right, in the service connection. And then did that person evaluate you, right? And that's, in my opinion, you got to have an evaluation. I know that there are a lot of services that will just review your records, right, and give you a Nexus letter. And that's fine, and that might work in some cases, but I like getting that evaluation, okay, because you always get more information. I always get more information when I talk to a veteran, like 100% of the time. I get more because as I talk to them, they tell me little clues, little hints, right, where I can add that to the evaluation and say, hey, this person has this type of migraine, and this study shows that this type of migraine is associated with this, okay? So that's kind of how that works. The evaluation, and then medical literature, okay? So especially in secondary claims. So if I'm saying that depression is caused by chronic pain for this individual, I got to provide the evidence, right? And even though that all psychiatrists know that, but I got to provide the evidence so the VA can see it and say, oh man, okay, he's got us. Okay, he's got all the peer-reviewed journals. These are all reliable. We can't fight it. It's done. So medical literature. And then, yeah, and those are some of the key components. Hopefully I didn't miss anything there.
No, that you hit them all. And I want to add to that too, Slick the Ripper. So Dr. Sharma's answer was long for a reason, because a lot goes into Nexus letters. And I think that bars the question. I don't want to answer that, but I want everyone to think about it. Why, when a veteran submits a Nexus letter with a DBQ, why is it denied by the VA? Okay, it's because it lacks one of those things. Not just like a Nexus letter has to be a complete Nexus letter. If it's lacking in one area, the Nexus letter all of a sudden that holds this weight from a psychiatrist, if Dr. Sharma doesn't review your records, all of a sudden the VA is going to be like, okay, well, let's have a CMP exam then. And now you're back at square one with the CMP examiner, okay? And I say it like that because Slick the Ripper, I want to provide you two options. One, if your doctor, I'm assuming it's a private doctor, okay, says they'll write a Nexus letter for you and it's free, hey, go all for it, okay? There's nothing wrong with that whatsoever. If you're paying for a Nexus letter and your doctor is asking you how do they write one, I think it's implied that you just get another doctor to write that Nexus letter, right? So, but I'm assuming it's a private doctor and it's free, and if that's the case, I'm 100% for that, okay? And hey, if that claim gets denied, it's not the end of the world. You have the appeals, and you can get another IMO, depending on why it was denied, right? So if it's denied service connection, and you submitted a Nexus letter, it's probably because the Nexus letter wasn't good. So that's something that you could explore. But that's in the appeals process. Feel free to send me an email. I definitely got some questions for you on that one. Okay, Florida Marine. Hey, this gentleman checked in last week. I also told him to ask his question here this week. He says he checked in a little late. He apologizes. Dude, don't be sorry whatsoever. Yeah. But Dr. Sharma, real quick, can you cover sleep apnea and hypertension secondary to PTSD?
Yeah, great question, and no worries. Glad you checked in. It goes back to needing multiple factors, right? So a PTSD by itself is difficult to connect to sleep apnea, although it is done, right? It has been done and it is done. But we want to combine multiple factors. Like, all right, so you have PTSD, were you deployed to one of these PACT Act areas, right? Did you have inhalation of heavy particulates? Okay, we bring that in too. During the evaluation, I'll talk to you about, did you see burn pits? Did you see those, out there they had countless things, right? Different pits and different fires, whatever. And we talk about all that. And anything else. So medications can worsen sleep apnea. So
that's a big one, I believe.
Yeah.
That's a huge one.
Yep. Yeah, and even somebody had written gabapentin, I think, in the chat at some point, and I forgot to mention it, but gabapentin has been shown to worsen sleep apnea. And gabapentin is commonly used in pain conditions, neuropathy, a lot of different things. So keep that in mind. And then hypertension, if the timeline is good, it can be connected. All right, so this individual got went through these traumas and started having symptoms, and then the hypertension, high blood pressure was diagnosed, and we can tie that in. That can be done as well.
All right, yeah. No, that's a great question. Florida Marine, I hope you're on to hear that. That's a great answer. Real quick, HP Power donated $30. Guys, seriously,
wow.
Thank you. I appreciate that so much. I'm not joking. From the bottom of my heart, thank you very much. We also have Cool Breeze with a $10 donation. He says, good looking out, CivDiv. Hey, man, thank you for coming. Without you guys, there's no live stream, okay? Without questions, there's no live stream. And those of you that have asked and kind of talked about personal stuff, I thank you for that deeply. Veteran disability is it sucks, you know? It definitely sucks. So it's brave to come on a YouTube channel, right? And type in your personal medical history. So I appreciate that. Thank you very much. All right, next level cash. This is something we've talked about over a few months, myself and him. He says, on a different note, he submitted his initial request for his claim file in July of 22. That claim was closed on December, and he actually received his C file January 10th. So what is that? God. That's July, August, September, November, or no, July, August, September, October, November, December, January. So about 6 months. That's about right. I want to say on average, anywhere from 5 to 8 months. So 6 months definitely falls into that. But yeah, it takes a long time. And you know what's crazy is it's actually on a compact disc. So next level cash, you might have to run to your nearest Goodwill or Staples and buy a CD burner, right? That's what they're giving out, okay?
Yeah.
All right.
I don't think computers have CD drives anymore, right?
No, I don't. Mine doesn't. I don't know.
Me neither.
All right. Teat on. I have my appeal on Tuesday with veteran law judge. Okay, another Board of Appeals. Good luck. I'm wishing you all the luck. You're at 60% knees and tinnitus, PTSD denied. I appealed. Okay, awesome. Definitely let us know, Teat. And I will say this. If you're denied this Board of Appeals, depending on why you were denied, send me an email because the reason matters, okay? But depending on why you were denied, maybe that's an avenue that Dr. Sharma can step in and fill that service connection role, right? But it really depends on the reason why you were denied in the first place. Okay. Brian Green, PACT Act does colon cancer, part of the gastro cancers. I don't know exactly what PACT Act covers off the top of my head. I have to go look it up. Send me an email, Brian Green. But if you're saying that they do cover colon cancer, if you have the diagnosis and you meet the timeline requirements, then it's an easy win. Mm-hmm. And that goes for everything in the PACT Act. If you have the diagnosis, you were in country during that time frame, submit the claim.
Mm-hmm. And colon cancer is a type of gastrointestinal cancer, so if it is on there, it should be. Yeah.
Absolutely. Yeah. All right. Valhalla BJJ, he says, thank you. I'll be contacting you, Doc. Hey, there we go.
Thank you.
Yes, that's what we're here for, right? Helping veterans, all right? Greg Schultz, Cash, good to know. I just requested C files about a month ago. Oh yeah, it's gonna take a long time, brother. Take a long time. Can't view doctor's contact info. MYOB. I'm gonna type it up in the chat again. Prashant.Sharma@concisepsych.com. See, this is so last stream I was doing this, and someone donated money to get a wireless keyboard so I can do it right here. I haven't set it up yet, but I will. Okay.
That's awesome.
All right, I just put his email in the chat. Also, concisepsych.com. That's the website. Go ahead and check it out. All right. Next level cash. Good info. C file. Oh, yeah. There's a lot of information on your claims file, right? It comes with your VA medical records. To sum up what's on your C file, anything the benefits of Veteran Affairs, the BVA, anything they looked at on any of your claims is a part of that C file. So you'll see your service treatment records from the military. That's in there, okay? Stuff like that. All right. Robert Hayes also sent email about questions diagnosed with anxiety from VA. Can I link? Okay, so he's asking, can Robert Hayes link back and tinnitus to anxiety?
Oh, yeah, good question. Yes. So like a lot of folks, knee, back, and tinnitus. Okay, so a lot of folks will tell me that they've got knee pain, back pain. It contributes a lot to their anxiety. It contributes to their mobility, right, where they can go, activities they can participate in, things like that. Tinnitus too, the sound itself. There's a lot of factors there, I guess. There's anxiety about not being able to hear your surroundings, right? And especially with veterans, there's that hypervigilance, anxiety. So, yeah, I rambled a bit, but the short answer is yes.
No, that's great. I have a question. So this is a genuine question for you, Doc.
Mm-hmm.
So sleep apnea, you're looking for multiple things to connect, right?
Yes.
And for, let's say, just anxiety, is it the same concept as you're looking for multiple things to contribute to anxiety? Or would you pick, like, would tinnitus be better than back? What's your opinion on that? Like, would you go for multiple connections? Would you go for one? And does it matter?
Oh, yeah, that's a good question. So I can say definitively with that is that sleep apnea is the one that I can think of right now that I do multiple, but everything else that I do usually one factor. Yeah.
Okay,
So
absolutely.
yeah, yeah. And that's because of the responses I've seen from the VA,
Ah,
and I want to preload our chances to get it approved.
yeah, so yeah, that's it. That's
Yep.
what exactly I was driving to, right?
Yep.
So I'm glad that's just an indicator that you write good Nexus letters, okay? And
Thank you.
so so when it comes to knee, back, and tinnitus, let's just assume you don't know anything else. You just know there's knee, back, and tinnitus. Of those three, which would you choose to write? Like, how would you connect anxiety to those three? Would there be one over the other? What would be your route, and how would you determine that?
Yes. Okay. Good question. So I would determine that based on the records. So in the records,
Yeah.
if you've written, if you've told your doctors like, man, this tinnitus is just, it's just too much. I'm anxious because of it. Et cetera, et cetera. If you've talked about that, then I'm definitely going to go with tinnitus. And same thing with the knee and back. If you've talked about the knee and back contributing to your anxiety, I'm going to go with that.
Yeah.
So
Agreed.
yeah. Yep.
Like I always say this multiple times every live stream, medical evidence is king. The
Yep.
VA cannot ignore medical evidence. And so that's definitely the route to go. All right. Okay, Greg Schultz, I have my CMP appointment this Monday. Good luck for that, for my 20% service-connected knee. I won't be playing Tough Marine this time around, almost 10 years since initial claim. Absolutely, right? So that brings up a great point. Playing Tough Marine, it's one of the common things I see all the time. Veterans lack evidence because they just don't go to medical, okay? Especially the Marines. I'm biased towards Marines, but there's a lot of pride. There's a lot of pride there, okay? And there's a lot of pride to your unit and your squad, right? So you don't want to be that guy, which really sucks because turns out 10 years later, you got 3-4 pumps to Afghan, Iraq, Syria, and now your knees hurt, and now you have no evidence for your knees, right? So that's a double-edged sword there. But wishing you the best of luck. Let us know, Greg, how that worked out for you. Definitely don't play Tough Marine. Just be honest.
Yep.
I do get a lot of questions on CMP exams, and I always say these three things. It's be open, be honest, and be vulnerable. If you do those three things, you'll be okay. All right. HP Power, brother, thanks for the donation. I appreciate that. Can the good doctor, I think that's you, right? Can the good doctor, not the TV show, it's you, right?
Right.
Can the good doctor provide a written Nexus letter linking hyperthyroid with commonly associated depression? Oh, I think we answered this, right?
Yep, I can. And remember, I review your records before charging anything. So yeah, I can do it, but I would review your records first just to make sure we got everything in line.
Absolutely, right. All right, I think that's a double tap there. All right, Omar Gonzalez, can you assist in getting a diagnosis for PTSD and IBS? Doc, what you got? Can you diagnose?
I can. There's plenty of times that I see veterans where they've been through the VA system or outside medical system where they've talked about some of these symptoms, right? So you might have talked about hypervigilance or anxiety or maybe some low mood or things like that. Nobody ever diagnosed it, right? And I see this a lot in the VA medical system where the doctor will write all the symptoms and then they won't add the diagnosis to the problem list. It drives me crazy, right? But I can use that to make the diagnosis. So 100% I can make the diagnosis, and I would do a DBQ and note it down there as well. Of course, it helps if the VA has made the diagnosis before, because in the DBQ, I can put date of diagnosis as that date that the VA diagnosed you with that thing, okay? But short of that, I can put the diagnosis as the date of our evaluation, but incorporating the records from the past. So.
Absolutely. All right. USMC Big B, this is a big question here, okay? 22 years ago, time gap, VA said I had a back sprain. All right. Last year, you got an MRI that proved, the MRI proved it wasn't. They insist my neuropathy is from my diabetes. 7-8 years before going diabetic. I say back, how do I prove it? Okay. If you have anything to add to this, please do. I do have one thing. So one, USMC Big B, I'm just going to keep it real, okay? You're fighting a medical doctor, okay? Not easy. Not easy when it comes to their field, all right? How can you prove it? It would be a second opinion, I think. I think going I'm assuming this is a VA healthcare that diagnosis, right? So my recommendation would be go to a private healthcare, see what that doctor says, and then go from there. The flip side of that is if they agree, I mean, it is what it is, right? Doc, you got.
Yeah, that's an uphill battle. That one.
It's hard. It's hard.
That's a hard one. Sorry.
All right, Big Bruiser. I'm trying to get an increase for my major depression from 70 to 100. Okay. I get really bad auditory hallucinations that affect me at work and cause me to lose income. The VA still denies my increase. Okay. Do you have anything to add from that? We're talking specifically 70 to 100. So he's already service connected 470. He wants 100 but was denied. What do you have for that?
Got it. Right. So can the VA still deny the increase? Yeah. I mean, they could, but I would basically take you through those symptoms that are also listed on the 38 CFR. But I would take you through, and absolutely auditory hallucinations is significant, right? So I would put that, and I would probably ask you a lot of those other questions too, right? Danger to yourself or others. Are there perhaps suicidal thoughts that come about intermittently? I would take you through all those other questions. And then anytime that if we're considering going to 100%, I have a separate set of questions that I ask, and it has to do with activities of daily living. So, there's, of course, personal hygiene is on there, but also other things, shopping, transportation, cooking, then occupational as well. So I ask a lot of questions on there to sort of load it in and prove it to the VA that this is totally socially and occupationally impairing, right? Because that checkbox that you see on the DBQ where it says like total impairment is at the bottom, we have to prove that if we want to get to that 100%.
Yeah, the key word there I think is prove.
Yes.
That's solid, right? And it can't be Big Bruiser said this. There would need to be definitely proof. Lay statements could back that up, but I don't think that would be a burden of proof, right? You would have to have medical evidence or something that's saying, hey, your mental condition is the symptoms are so severe, you basically can't live your life, right?
That's right. And
it's 100% mental health condition is serious, very serious.
Yeah, that's SMI, right? Like serious mental illness, where it has to be at that level. And when you say evidence, just go to the doctor, right? And talk about your struggles. I didn't mean to say just. It's not easy to do that, but that's the meaning of evidence, right?
Oh yeah, absolutely. Greg Schultz, donator, appreciate that, man. He says, this is gold. So glad I stumbled across TheCivDiv. I remember this guy. I put out a video about VA Claims Insider maybe a week ago, and he had an appointment with them, and I was trying to convince him not to go. Okay. I know that was a little direct anti, for-profit companies, but hey, brother, I hope it worked, right? Hope you cancel that one. Mario says, share the stream. Yes, guys, please share the stream. When you like the stream, more veterans within that audience are more likely to see that come across their YouTube page. So please like the stream. Please share it. We're just out here helping veterans. That's it. Will Robinson, does the VA give a rating for flat feet? Yes, they do. I think the maximum rating is 50%. And it goes off, there's a bilateral factor that could be for that, if both your feet are flat. And flat feet definitely cause some secondary issues to your knees, maybe, and especially your hips. So that's definitely, if that's you, I would say that's what I call a big ticket claim. That might be worth the fight. That might be worth the uphill battle, depending on your medical evidence, right? Robert Lithicum. This is the first time I've seen someone's name with a check mark that looks like this. That's pretty cool. I don't know why that's a thing, but I assume it's because you're a supporter. I appreciate that. If it's not, I'm just going to make myself believe that, okay? He says, why does the VA put the burden of a diagnosis on the veteran? We can only report symptoms, but the VA seems intent. So when there's an intention on putting a label on everything. Can you... I have an answer. I just don't think it's the best answer. Do you have anything for that, Doc?
Yeah, I think it's a really good question, and it's kind of a tough one to navigate because the burden of the diagnosis is not technically on the veteran, although it feels like it is, right? Because I understand the frustration, because the frustration there that I think you're saying, Robert, is that you go and report your symptoms and you say, I'm suffering from diminished sleep, not interested in activities, like all the symptoms of depression, but I'm not getting the diagnosis, right? Like, what is that, right? And I think that's the unfair part, right? Where the diagnosis is not getting in there for some reason, right? And a veteran recently told me this exact frustration, and he said, I don't want to go to the VA and say, can you diagnose me in the record because I have these symptoms? Because then they look at me as if I'm trying to get something, right? And I understand that as well. So that's the frustrating part. I think they don't see it as that way. I think they see it as, the burden of proof needs to be there from medical evidence. It can't be just what the veteran says, because then you don't know what's right and what's wrong, I guess. That was not a good answer, though. I don't know. Clayton, you can.
Yeah. So one, my wife texted me because she heard my stupid statement I said. She said the check mark means they have a verified channel.
Oh.
Again, I'm going to make myself believe that it's for me. So thank you. Appreciate that, right? Okay, so I like how you phrase... I think you phrased that very well, right? Because we describe... I'll give a personal example. I try not to give too much of my medical stuff out there, but I will in this instance. So I was looking... I have lower back pain. This was years ago. And I was trying to get a diagnosis for radiculopathy because I wanted that secondary connection. This also answers Brian Green's question. Speak on secondary cervix connection. I'm gonna 2 for this, right? And I told my doctor, who my VA doctor I see probably 6 times a year. I like her. She's good, right? So it's nothing bad about the doctor, but I was really wanting a diagnosis. And I told her, hey, my legs go numb, my feet go numb randomly when I'm sitting down, when I'm standing up. I can't do either or for too long. And I give her this detailed list because I understand the VA system, right? So I'm trying to express my symptoms clearly. And I still didn't get a diagnosis, right? Which definitely sucks. It sucked. Like, whenever I heard that, I was like, dang, doc. And I think... I'm going to answer this from a veteran's perspective. I think it's because in that instance, I made this appointment to get a diagnosis for the purpose of submitting a claim. Okay? So that diagnosis, that claim is on my mind, where my healthcare doctor, VA healthcare, is over here, and benefits is over there. And they're not connected at all. Okay? Department of VA, that's it. So the Benefits Administration, Healthcare Administration. And so the claim is on my mind, but my doctor's like, oh, okay, let me refer you to physical therapy, right? Because they're in health care. That's the treatment plan. So I don't want to, by any means am I saying, hey, my doctor sucks. I guess is a very plain way to say it. Because she doesn't. She's very great at her job. She did refer me to physical therapy, got some medicine, right? But that's the healthcare side. But it still doesn't take away when I do submit that claim, they're going to see, oh, Clay Sims said these symptoms on this day about his back. So although the diagnosis isn't there, the CMP examiners, if you have it, it's going to be a diagnosis, right? I say that very loosely, right? If you have the symptoms, it's likely to be diagnosed because that CMP examiner has the mindset of the disability claim. So like, okay, you need a diagnosis. Are you diagnosed, right? Is there enough evidence, not hearsay, is there enough evidence to give you a diagnosis, right? And I think I would argue that is the relationship between the veteran, a diagnosis, and VA healthcare, right? Because it's just different mindsets.
Well said.
I think that would be my best shot at it. And for Brian Green, speak on secondary service connection. I like to explain. Oh, hey guys, let me change my battery. Doc, can you speak on secondary service connection?
You got it.
All right.
Yeah. So basically, when you have secondaries, it's piggybacking off a primary diagnosis, right? So if let's say you have tinnitus, right, and you have 10% for tinnitus, but it causes so much interference in your daily life, and it just demoralizes you and depresses you, and it causes a depression. So that is the secondary connection there, right? The thing about secondary connections is that with secondaries, you don't need to have that in-service documentation, right? You can actually have the secondary connection after the fact, right? Because that's the meaning of the secondary. You have tinnitus, and it gets to a certain point that it is so severe and distracting that it causes a depression, and that might be 10 years down the line, 5 years, whatever. So that's how I look at secondaries, that they come after the fact, and they come from one of the existing service-connected diagnoses you have.
Yeah, exactly. So what I was going to, so how I like to explain secondary service connection, I use two scenarios. The one I just explained with radiculopathy, it's a lower back pain, I would say that's an easy one for CMP examiners to agree with, right? The reason why is because there's x-rays. You can see it. You can see sciatic nerve damage. You look at my symptoms, bada bing, bada boom. The CMP, it's hard for the CMP examiner to say that's not connected, okay? And so in cases like that, I would say this is not a dig on CMP examiners. It's going to sound like it is, but it's not. In that scenario, the CMP examiner agrees with the secondary connection, right? Because it's an x-ray. If they disagree, I think the VA rater would be like, I think the CMP examiner is stupid, for lack of a better term. I'm gonna give it to him anyways, right? Versus the opposite, where it's like, okay, you're claiming depression secondary to back pain. Well, there's no x-ray of depression, right? It depends on what your medical evidence is. And what is that medical evidence? Is it you talking to your doctor? Is it a lay statement? See, it's not as definitive from the CMP examiner's perspective. And again, that goes back to what we talked about, Doc, where you spend an entire day, sometimes 3 days, on a Nexus statement, where that CMP examiner sees, 10 veterans a day. They have a 15-minute appointment, and all of a sudden you have a less likely than not, depression secondary to back pain. And it's not because I'm going to give one to the CMP examiners. It's not because they are bad. I just think that what their purpose is, it's quick. Okay, yeah. It's quick versus an independent medical opinion that actually reviews, that actually knows your name. I can tell you right now, any CMP examiner I saw, they probably wouldn't even know that they saw me, right?
Wow.
Versus like an IMO, like you spend a whole day writing a Nexus. I'm sure 6 months later, I think you said B-Buck, you wrote a Nexus for B-Buck. I'm sure 6 months later, his email comes across your email. You'd be like, hey, I know this guy, right?
Oh.
And that's a different relationship, okay? So there's a lot that goes into that, but CMP examiners, I gave them one, then I just took it right away. All right. Super Haram. If I get the Nexus letter in private DPQ, so I still have to go to a CMP exam.
Oh.
Do you have anything to add to that?
Yeah, that's a really good question. So I've seen different outcomes on that. And I don't, well, Clayton, you can tell me if you've seen any like rhyme or reason with it, but some people that I've written letters for, they get told that, oh, you have a fully developed claim, and they get granted, the rating. And then other people, they still have to do the CMP exam. I don't know what governs that. I will say that most people have to do a CMP exam from what I've seen. But let me know what you think, Clayton.
Yeah, I agree. I think there's definitely majority of going to a CMP exam too. The only reason the VA would schedule a CMP exam, I'm going to give you the only real reason, and then I'm going to give you like the conspiracy theory reason, okay? The only real reason is because they need more information. They need something's missing for the VA rater to be like, hey, I need this information, and they're gonna contact the CMP examiner. That examiner gets paid. Okay, it's a contract between them and the VA, and the VA is gonna say, hey, I need you to answer this question for me. All right, cool. That's the real answer. I'm gonna give you a conspiracy theory, okay? And I'm really not trying to dig the VA on this one either. I don't want this to go down to a rabbit hole, but there's definitely a sentiment. This is not fact-based. There's definitely a sentiment on the VA saying, you know what? Maybe this Nexus letter came from a psychologist. What's missing? Did this IMO examine all the medical evidence? Is there, which leads me to another question, is there contradicting medical evidence, right? Did the examiner, did the IMO examine all the evidence? So that's what I really want to jump to. But the real conspiracy theory answer is, can the VA deny this claim? And I hate, even those words come out of my mouth. I just hate myself for saying it. But there's definitely a sentiment there, okay? It's not. That's it. I'll leave it at that. It's a thing, right? It's a thing.
Absolutely, yeah. And I also I don't have anything fact based, but I can definitely tell you that I've read. I'm not going to give too many details here, but I've read a CMP exam written by a psychologist that the VA contracted with, who said that alcohol use does not cause hepatocellular carcinoma, which is a specific type of cancer, right? In fact, it does, right? Alcohol abuse does cause it. But they took that word, from the psychologist, which was really frustrating because I'm like, again, the psychologist, and psychologists are great, okay? I love psychologists. I'm not in general, but a psychologist didn't go to medical school, so they don't actually know how alcohol increases the risk of hepatocellular carcinoma, right? So yeah, so I agree with you. There is that underlying like conspiracy type thing there.
There's something there. Can I prove it? No, but I've seen fully developed claims. I'll tell you this. If the VA got every decision right, then the higher level review wouldn't exist, okay? An HLR is basically, when the VA awards a higher level review, it's another way for the VA to say, hey, we made a mistake, sorry. Right, and that's what an HLR is. It's hey, the VA made a mistake. If they didn't, then you'll be denied again. Okay, so if they got it right all the time, it wouldn't exist. I'll leave that at that. Right. Okay. HP power presumptive condition. I did not need a Nexus. Yeah, absolutely. Mm-hmm. If it's a presumptive condition, you don't need a Nexus. And, the PACT Act is probably the bee's knees on presumptive conditions right now. I will say tinnitus within 1 year. If you're diagnosed with tinnitus within 1 year of leaving the military, presumptive, right? So that is the Nexus. The Nexus it's presumptive, okay? There will be a Nexus. In this case, it's presumptive, okay? Philip Castro got missed again. So excited to learn more. I just got approved for flat foot, toenail, 0%. Need to contact Dr. Sharma, CMP, done by a nurse. Yeah.
Oh.
definitely reach out, Philip.
Yes. Thank you.
In person and MD only. That's a great
Oh,
question.
no.
Yeah. Do you get that
No,
question?
no.
Go ahead. Go ahead.
Yeah. I'm sorry. I should have mentioned this.
Yeah. Same.
So I'm in Baltimore, Maryland, but I'm a psychiatrist. I can see you on video anywhere in the world. Okay, so I have veterans who I've seen in the Philippines, or or Mexico, and I've written letters for them because as a psychiatrist, I can do it over video, and I review the records. So yeah.
Yeah. I want to do a flip side of that, right? If you have a physician, if you want an IMO on a knee or back condition, that physician is going to need to see you in person, right? So it's not always the case, but with mental health disorders, online is the way to go.
Yes. Yep. Good addition. Yeah.
All right. Nayo, less than 15. Oh, yeah. Okay. Yep. USMC Big B. He was saying less than 15 minutes of his CMP exam. We finally reached that. How many questions there are? Okay. This is the first time on this stream I've had this many questions. I am just blown away. Thank you guys. Appreciate it.
Thank you guys. Yeah.
All right. USMC Big B. I don't think I've ever been to a CMP exam that lasted more than 15 minutes yet. Yeah. I've had. I will say this. I think I don't know if it was lucky, but when I was claiming some disabilities, I had one CP exam last like 3.5 hours. That was before I knew the VA claims process, which I now know was out of the ordinary. Okay, just from talking to veterans, but yeah. All right.
Wow.
Devin Duncan. Yep. Thank you, Philip. Seen for different. Yep. Absolutely. Does going to VA primary care, going back up, Philip Castro, reach out to Dr. Sharma.
Yeah.
All right, definitely do that.
Yep.
Edwin Martinez, does going to VA primary care for something small, like checking blood work or something, that concerns you, but has nothing to do with any of your current disabilities affecting anything with 100% P&T vet? All right, I definitely got this one. Okay. This is the second most common question I get, okay, is can my P&T get taken away, right? And I'm going to give you the technical answer, which is yes, it can, okay? Nothing's safe until that 20-year rule. But if you are P&T, what P&T means in VA terms is the VA says, hey, these conditions are not going to improve over the veteran's life, which means your disabilities are static, okay? So if you do rate P&T and you go seek health care or you make more special monthly compensation claims, you're fine, all right? You're okay. On the flip side of that, if you go to a healthcare appointment, let's say you have a 70% mental health rating, you go talk to your doctor, they're like, hey, how's your PTSD doing? And you're like, you know what, doc, I've miraculously been cured. I'm healed. I have no depression, right? Obviously, that's an extreme scenario. That's probably not going to happen. But if that did happen and the VA reviewed your records, they'd be like, oh, well, obviously it improved, okay? So as long as you're not out here saying crazy stuff and you've miraculously been healed, you're okay, right? It's a very anxiety-ridden question. If you have P&T, don't worry about it. You're good, I promise. All right, John Sullivan. After my toxic exposure, I had a DUI event with a court-martial. Okay, so we're definitely getting into some UCMJ right now. Mental health counseling, alcohol counseling, busted down, not able to make rank before 4 years was up, honorable discharge. Okay, Johnny, none of the UCMJ stuff matters because of those last two words, honorable discharge, okay? So I'm assuming that's leading to a VA benefits question, right? And yes, you're eligible. Straight up fact, right?
Yes.
If you had something that happened on active duty, you can claim it as a VA claim. There we go. Right? Whether that was alcohol counseling, health counseling, I'm going to assume there's some mental health conditions there.
Yep.
Dr. Sharma, he's here for you. All right?
Yep.
So definitely reach out.
Yeah, and you have the evidence because you did the mental health counseling and everything. So,
oh, yeah. Mm-hmm. Absolutely. All right. Alan Lavelle, rated at 40%, have DJD. Do you know what that is?
Degenerative joint disease.
Okay. Recently from neck to tailbone. Okay, that makes way more sense now. Should have kept reading. Nexus letters ready. Okay.
Oh.
Wants to do a spinal exam. I'm in constant pain. Should I wait for exam to be done first? No, you're fine. So what I would suggest, and if you have anything on this, doc, go ahead and chime in. But you can do both at the same time. Once that exam is finished, in a perfect world, you could get a printout of those results, right? If there's a diagnosis that comes with that, it probably will take a couple days. Regardless, go to your VA Blue button. You'll be able to see those records, assuming this is VA healthcare. And then you can submit that on Quick Submit, which is VA's new way to upload evidence. And then you can do that at the same time, right? But yeah, I guess what I really want to say is if you have evidence, make sure the VA has it, right? Keep it simple. Do you have anything to add to that?
No, that makes sense to me. I got nothing else.
All right, Florida Marine. I think this is a copy-pasted question. We answered this earlier. I hope you were here for that. All right. MYOB. We just got to our first donation. How many questions is that, right? All right. Appreciate that, Robert. Definitely check mark verified. Thank you. All right. It's for me, though, right? The check mark's for me.
Exactly.
Okay.
Yeah.
MYOB. Any way to reply chat? TMI. Too much information, too fast, overwhelmed. Is doctor available in person in what state? Yeah, so do you want to double tap that again, Doc?
Absolutely, yes. Email me. I'm a psychiatrist. I can see you on video anywhere in the world. So it doesn't matter what state you're in. I can see you. And obviously I would need your records, electronically, but I can see you and write a letter.
Oh, yeah, and this is a little later in the stream. We've been streaming for over 2 hours now. We have 15 more minutes, guys. We're going to try and get through as many questions as we can, but I do want to say this because we are later in the stream. Dr. Sharma, you review records in the veteran's case before charging, right? Can you explain that real quick?
Absolutely, yes. So the sequence is you contact me, we have a phone conversation to discuss your case, and you get a feel for me as a person, who I am and stuff. And then I email you a summary, and I ask you to send me your medical records. I review all your medical records, and then I tell you, should we go forward or not? Is this a good claim, Nexus letter claim? And then we go from there. And then you schedule the video evaluation and pay, but that's not until after I review the records and confirm. Yeah.
All right.
Yep.
Okay, scrolling down to Gilbert Garcia, a few questions later. If you have both knees replaced and you are better, can my rating go down? Yeah, so Gilbert, your knee replacement, I believe, fact check me on this, but I believe in 38 CFR, you have 1 year, you'll be rated at, I want to say 100%. I want to. Especially if you have both, you probably have 100%. But once that time frame, the time frame might not be 1 year, it might be like 6 months. Fact check me on that. It's in 38 CFR though. But to answer your question, can your rating go down after that time frame? Absolutely. So what's going to happen is once you have the knee replacement, the VA is going to say, hey, here's some extra money as you heal, right? So you're going to get that 100% rating. 6 months go by, a year go by, whatever the time frame is. Then they're going to evaluate your symptoms. And then, yes, they're going to give you a rating for your knees according to 38 CFR, and you go from there. So to answer your question, yes. All right. Hey, thanks, man. Robert said congrats on the birth of your daughter. Yep, thank you very much. Appreciate that. She's a baby. All right. Good evening. Good evening, Denison. What's up? All right. Robert Lithium said, if you take a reasonable shot of Johnny Walker before the end of the live cast, I'll send another $10 challenge. Everyone do. Well, I guess I'm going to. I can't say no to that, right? That's awesome. Let me send a text. Bring me a shot glass. I guess I will. I can't say no. Okay. All right, whatever. We'll do it. Cop D Warrior Simplify Killers. What's up, man? Appreciate it. Mario, thanks, man. Yes, please share the stream. Like the stream. This stream will be up on YouTube permanently. So there it is. All right, Antonio Washington. The VA will not award me for sleep apnea. I have a sleep study and a CPAP. I need help. Doc, what do you got for that?
Got it.
So he's got the diagnosis. He's got the treatment, right?
Yeah.
So if he was rated, it would be 50%. What's up?
Right. So you got to have, we got to look at the evidence, basically, right? And, when was the sleep apnea diagnosed relative to military service? Can we get a connection? Were you in an area where you inhaled heavy particulates? Do you have other diagnoses? If it wasn't incurred during military service from the evidence, then do you have other diagnoses that it could be secondary to? Probably need some more information. Yeah.
Oh yeah, definitely. Evidence is going to be key there.
Yep.
Absolutely. All right. LG says, as part of my IDES process. So, Doc, do you know what IDES process is?
Yeah, I forget now. I heard it in the past, but now I can't remember.
Over here.
Yeah.
She brought me the glass. Okay. All right. Okay, so IDES is a veteran, a service member going through a med board, and the PEP and VA claims via med board. Generally easy. I mean, you're getting medically separated, so the DoD and VA basically have this IDES process where you get your VA claims at the same time. So you get a DoD rating saying you're medically separated or medically retired, and then that would translate into a VA claim. So that's what IDES for. And the question is, mentioned the pain in my jaw. Okay, so there's definitely some dentist issues there. Dentist CMP examiner said I have TMJ and bruxism. I've never complained about it to the VA. Do you think it'll be denied? Absolutely not.
Mm-hmm.
Not at all, especially through a med board. I will say, however, that was rated. So the DoD rating is your ability to perform as a service member, right? The VA rating is a VA disability that affects your life. It's two different ratings, completely separate. That's why you'll have like a 30% DoD rating and a 100% VA rating, right? They're separate, but I don't think it'll be denied at all. We have some more donations up top. Orange Remediation, brother, thank you so much, $10. This is the gentleman that donated last week to get my wireless keyboard. Orange, I'm glad you made it. I bought the keyboard. I haven't set it up yet, okay? I appreciate it, brother. Thank you. Robert, sent before the shot because I trust you. Now I have to do it. I'm sorry, right? I don't know how I feel about that on a live stream, but what's the worst that could happen, right? And then Hector Tanabe, another $10. Guys, thank you so much. All donations go straight back to the channel. I appreciate it. We're very blessed here. All right. Dennis Denson. What time is it? 9:18? Okay. Dennis Denson. Civ, I sign up on December 23rd with Del K. Graham. Haven't heard anything yet. How long is the response? I'm glad you brought that up. We've been so focused on Dr. Sharma, I totally haven't mentioned any of this right yet. So for everyone in the chat, I volunteer for an accredited veteran service organization, Del K. Graham. They are Oklahoma based, but they accept all veterans via Zoom calls, right? Or online meetings. How long is the wait process? I want to say right now, without checking the system, it's about 10 weeks. But the good thing about Del K. Graham is when you sign up for Del K. Graham, if you don't have an intent to file in the VA system, the second you finish that intake process, Del K. Graham automatically puts that intent to file in for you. And so as far as pay is concerned, it's going to be back paid. You're going to be good. We have another donation from Michael Walker. He says, thank you for having this. Brother, thank you for showing up. Thank you for all the questions. I appreciate it. Without questions, there is no live. I'm blown away right now. I'm insane. This is insane. This is insane to me. Okay. Awesome. I started this channel on a thought, and now it's growing into something that I just can't. I'm blessed. I'm very happy. All right. Happy to help veterans. Okay. Philip Castro, wow, I need to contact you guys. Sound great. I'm tired of paying so much for a POOD rating. I paid 3. Absolutely. Philip, I'm assuming you're talking about you've paid for 3 Nexus letters.
Oh.
I know we talked about this before, and I want to challenge you to talk to Dr. Sharma, because I genuinely believe Dr. Sharma will give you the real answer up front before charging, right? And if he feels like he can help you, he will. And if he feels like he can't, he will let you know. Okay, and I think you need to hear one of those two statements very clearly. I think Doc, if he reaches out to you, please take care of him. Appreciate that.
Yeah, absolutely, will do. Thank you.
LG, another $10 donation, guys. I don't even
Wow.
gonna make me cry, dude. I'm serious. Thank you. He's got the emoji there with the muscles and all that stuff, right? Robert Hayes, brother, thank you. Simplify, right? I was in the Marine Corps for 10 years. Robert Hayes, let me know when you were in the Marine Corps, all right? I guess, well, I got 9 minutes. I'll save the shot for last, right? I'll close the stream with a shot. All right. B-Buck, he says he'll be sending us both a copy of the decision letter. Please do, right? That would definitely validate this stream, and it's a good assessment tool, right?
Thank you.
All right, yeah, absolutely. Sue Peacock, hello, I have 10% for tinnitus. Looking to go for secondary anxiety and depression. My late husband had a Dr. Sharma in Salinas, California.
Wow.
Awesome. Well,
Wow.
sorry for your loss, but it's definitely a small world out here. All right, Doc. Secondary anxiety, depression to 10% tinnitus. What you got?
Absolutely, yeah. We can talk through it. Like Clayton was saying, I review all the records first, so that's the first thing that I would do is review your records. I would look and see if you've talked about this anxiety, depression previously, right? If you've talked about it over time. And yes, it can be connected, absolutely. There's a lot of literature on this showing the connection between tinnitus and depression and anxiety. Keep in mind it falls under one umbrella, right? The mental health diagnosis. So it'll probably be, the technical name would be depressive disorder secondary to known physiological condition, which is the tinnitus, with anxious features or something. That's what the rating would come out as, pretty much. But yes, we can do it.
Awesome. This is a question I'm definitely glad USMC Big B asked this, because we've been pushing Nexus letters pretty hard, but they're not always needed, okay? So USMC Big B, he asked, do I need a Nexus letter? My lawyer, supposedly the best at VA claims, never even asked for it. So I'm gonna give your lawyer the benefit of the doubt and say that the service connection is already there. That's what a Nexus is, right? You're looking at service connection. So if your lawyer didn't ask for it, it's probably already there. But then again, that makes him wonder why you're in the appeals process anyways. So it depends on why it was denied in the first place. But here's another conspiracy. Oh, I gotta get away from conspiracies. So when it comes to lawyers, right? Accredited VA lawyers get paid in appeals. Meaning, if you submit an initial claim with a lawyer, they don't get anything from it. They get back pay on the appeals. Okay? So just hear me out for a second. If I'm a lawyer and I know I get paid in appeals, I want to be like, how long can this appeal process be, right? The longer it is, the more back pay you get, the more money I get. You're at a board of appeals, so I know it's been going for a long time. They didn't ask for a Nexus letter. I guess I am insinuating it's intentional, which is really bad of me. I should not do that, okay? But those are my two thoughts. One, you probably don't need it, or two, you're in the appeals process, and you're probably going to need appeal again, right? Which would it doesn't benefit you at that point. If I guess to answer your question, right? Okay, yeah, I got to get away from conspiracies, but it's money, right? Anytime money's involved, there's something there.
Absolutely.
All right, Robert, definitely answering your questions, brother. If your service records absolutely tie your condition to active duty service, you don't exactly, right?
Exactly.
It's not always needed.
Yep.
Right. All right. All right. So scrolling down, we have 5 more minutes. Dr. Sharma, I want to squeeze as many questions as we can in this last 5 minutes. Dead stop at 9:30 though. All right, Bro Clay, since the last live, my Pueblo finally reached out to me. So this is the medical board.
Yep.
That she's getting my NARSM signed. Hopefully, I'm getting closer to being retired. Thank you. Yep, you're definitely going in the right direction. Med boards take time, right? They can take 3 months. They can take a year and a half. Depends. All right, Virgil W. Israel. I've been diagnosed with severe anxiety by a doctor at VA. Scheduling an appointment with a psychiatrist. Is it better to wait and see them before filing a claim? No, not at all. You have the diagnosis. You might be missing service connection. That's my next question. But if you have service connection, go for it. If not, Dr. Sharma, everyone, here we go. Right, the service connection king. Okay. No. All right. Do you have anything to add to that at all?
No, that was perfect. That's
all
what I
right.
was thinking. Yeah.
Fred Christie, huge word, guys. I am a Marine. Keep it easy for me, right? Abnormal myocardial perfusion. That's my best shot at that. With large size, reversible defect, severe hypnosis of the apex, coronary calcification. Let me scroll down. Anything? I have a. Oop. Yeah. Is there a question implied from there? Do you see that at all, Doc?
I don't. That's what I was looking for. I scrolled. Oh,
I see it. Coronary artery,
yep.
Yeah, a risk factor. Will be going to found this on the nuke pet. Okay?
Okay, nuclear PET scan. Okay.
Let us know. Fred, send me an email, right? I definitely, since we got to your question, I definitely want to answer it. Send me an email of the actual question. We'll definitely get to that. All right? 3 minutes, guys. Philip Castro, thanks, guys. Good info. He'll be in contact soon. Yes, absolutely. All right?
Awesome.
Virgil also has a diagnosis for diabetic neuropathy in left leg as well. Do I need a Nexus, although it was diagnosed by the VA? Again, Virgil, you have the diagnosis. The simple answer is this. Do you have, when you were in the military, is there any evidence leading to that diagnosis? If the answer is no, you don't have service connection. You're gonna need a Nexus. All right, absolutely. And I think, let me add this too. So when I recommend a Nexus, Doc, before I recommend someone to you, here's what I always say. I say you have two options, right? The first option is to submit the claim without service connection, okay? The C&P examiner can very well determine service connection. They can. It happens all the time. It also gets denied a lot as well, right? And then, so I say submit the claim without a Nexus, or you can submit the Nexus up front, right? An independent medical opinion with a DBQ. Both of those options are fine. If you choose to not submit a Nexus, it's not the end of the world, because if you're denied, you can always use the IMO and DBQ in a supplemental claim and still get the back pay, right? So both options work, Virgil, whichever you prefer. You know your evidence better than I do, okay? But hey, at the end of the day, you can consult Dr. Sharma here, and he'll let you know the question. He'll let you know the real answer.
Absolutely. And you know, I see plenty of folks who, well, not plenty of folks, but a lot of folks who I look through and I see that they already have service connection, and I'm like, don't do a letter. You got this. You know. So. Yeah.
Oh yeah. Tony P, is there successful claims for vets who have obstructive lung diseases and served aboard old ships known to have asbestos contamination? Wow. I don't know of any studies on that. I think that it's worthy. I definitely don't know off the top of my mind. It's worthy of a lookup. I don't know of any presumptives though that stem from old ships specifically, right? There's definitely a lot of claims with asbestos. I'm definitely going to have to look that one up for you, Tony P. I don't know.
Yeah, me neither. Yeah, that's specific, you know? Good
All
question.
Right. Yeah. All right. One more question, and we'll end the stream, okay? Let's see. Robert B. Buck. Okay. Fred. Yep. Virgil. I'm trying to get a question. I'm looking at Dennis Denson. All right, looking for a question. Okay, max VA disability. All right, Something tells me you have a YouTube channel, Max VA Disability, and I pray you're not a for-profit company, because if you are, I'm coming after you. I'm just letting you know up front, okay? But we have a question. We will end the stream on this, okay? Max VA Disability. I have no experience with PTSD, okay? Is a person with a 70% rating functional on a daily basis, or how does that work? I have another channel, but I like your work. Okay, there we go.
Nice.
Right. I did not read that before I said what I said, but I meant what I said, okay? Doc, go ahead, answer this question. I'm going to pour the shot, and I guess we'll do this, right?
Awesome. Yeah, no, great question. So it really depends. So the 70% rating, I've seen folks who I wrote a letter that corresponded to that severity level. They got that severity level and they are functional on a nearly daily basis, right? So they're functional in that they have a job, they do their family obligations, things like that. But there is interference with their daily life from their symptoms, right? Maybe the flashbacks are so intense that they can't concentrate at their job fully, and so maybe their productivity is not as high as it should be. Maybe they don't get the promotions that they would have gotten, maybe the sleep impairment is so bad that they're irritable at their job and they get irritable with coworkers and their boss, things like that. Maybe the same thing happens at home. So that's the long answer, but yes, you can still be sort of daily functional, but the PTSD at 70% is likely having significant social and occupational impairments that I would ask you about and diagnose.
Oh yeah, and I'm going to add to that with maybe some scenarios, like someone with 70% PTSD could have marital issues, right? Mm-hmm. You can still maintain a marriage, but there's some marital issues there. You probably experience like personal hygiene, right? Shower once every 3 days, right? Is a clear symptom of some serious PTSD going on. You might have suicidal ideations, right? And all of those things, you can still be functional, okay? You can go to work with messy hair. It's kind of weird, but like you can, okay? You can go to work with marital issues. You can go to work with suicidal ideations. They might not be severe enough to keep you from gainful employment, right? Because I think that would warrant a 100% rating. But they are severe enough to where you have some serious social and occupational setbacks, if you will. But yeah, that's all I want to add, right?
Great.
All right, Dr. Sharma, brother, thank you so much, guys, everyone. Dr. Sharma, U.S. Air Force veteran psychiatrist, writes Nexus letters. ConcisePsych.com. Is there anything you want to say to close us out?
No, just thank you, Clayton, and thank you, chat, and everybody in the stream. This has been awesome. I loved answering all these questions and talking with you guys, and I learned a lot from you too, Clay. And this has been great. Thank you.
Oh yeah, guys! Every Thursday at 7 p.m. Eastern, I have a live stream. Usually it's just me, but if there's opportunity for more guests or Dr. Sharma again, you're more than welcome to come back. I will tell you this: next week there is no live stream. I'm going back home to my hometown so my daughter can see the rest of our family in Kentucky. But that's it. That's all I got. If you have a question, email me at TheCivDiv@gmail.com. Concise Psych for Dr. Sharma. And other than that, I guess I'll take this shot. Thanks to Robert here, and I'll close out the stream. All right. So, guys, thank you very much, and thank you for your service, Doc. It was nice to have you on. All right.
Thank you.
All right. Here it goes.
Thank you, guys.